Hey Alphaness, I'm Licensure from alphanessguy.com. This is 160 practice questions. Without delay, let's get started.
1. The nurse is reviewing the client health record and notes that the client elicited a positive Romberg sign. The nurse understands that this indicates which finding? 1. An involuntary rhythmic, rapid twitching of the eyeballs. 2. A dorsiflexion of the ankle and great toe with fanning of the other toes. 3. A significant sway when the client stands erect with feet together, arms at the side and the eyes closed. 4. A lack of normal sense of position when the client is unable to return extended fingers to a point of reference. The correct answer is 3. A significant sway when the client stands erect with feet together, arms at the side and the eyes closed. Rationale. In the Romberg test, the client is asked to stand with the feet together and the arms at the sides and to close the eyes and hold the position. Normally, the client can maintain posture and balance. A positive Romberg is a vestibular neurological sign that is found when a client elicits a loss of balance when closing the eyes. This may occur with cerebellar ataxia, loss of proprioception, and loss of vestibular function. Question 2. The nurse notes documentation that a client is exhibiting Cheyne-Stokes respirations. On data collection of the client, the nurse expects to note which finding? 1. Rhythmic respirations with periods of apnea. 2. Regular, rapid, and deep, sustained respirations. 3. Totally irregular respiration in rhythm and depth. 4. Irregular respirations with pauses at the end of inspiration and expiration. The correct answer is 1. Rhythmic respirations with periods of apnea. Rationale. Cheyne-Stokes respirations are rhythmic respirations with periods of apnea and can indicate a metabolic dysfunction in the cerebral hemisphere or basal ganglia. Neurogenic hyperventilation is a regular, rapid, and deep, sustained respiration that can indicate a dysfunction in the low midbrain and middle pons. Ataxic respirations are totally irregular in rhythm and depth and indicate a dysfunction in the medulla. Apneustic respirations are irregular respirations with pauses at the end of inspiration and expiration and can indicate a dysfunction in the middle or caudal pons. Question 3. The nurse notes documentation that a client has conductive hearing loss. The nurse understands that which is a cause of this type of hearing loss? 1. A defect in the cochlea. 2. A defect in the 8th cranial nerve. 3. A physical obstruction to the transmission of sound waves. 4. A defect in the sensory fibers that lead to the cerebral cortex. The correct answer is 3. A physical obstruction to the transmission of sound waves. Rationale. A conductive hearing loss occurs as a result of a physical obstruction to the transmission of sound waves. A sensory neural hearing loss occurs as a result of a pathological process in the inner ear, a defect in the 8th cranial nerve, or a defect of the sensory fibers that lead to the cerebral cortex. Question 4. While collecting data related to the cardiac system on a client diagnosed with an incompetent heart valve, the nurse auscultates a murmur, which best describes the sound of a heart murmur. 1. Lub-dub sounds. 2. Scratchy, leathery heart noise. 3. Gentle, blowing or swooshing noise. 4. Abrupt, high-pitched snapping noise. The correct answer is 3. Gentle, blowing or swooshing noise. Rationale. A heart murmur is an abnormal heart sound and is described as a gentle, blowing, swooshing sound. Lub-dub sounds are normal and represent the S1 first heart sound and S2 second heart sound, respectively. A pericardial friction rub is described as a scratchy, leathery heart sound. A click is described as an abrupt, high-pitched snapping sound. Question 5. The nurse is preparing to assist a healthcare provider to test the extraocular movements in a client for muscle weakness in the eyes. The nurse anticipates that which physical assessment technique will be done to assess for muscle weakness in the eye? 1. Testing sensory function. 2. Testing the corneal reflexes. 3. Testing the 6 cardinal positions of gaze. 4. Testing visual acuity using a Snellen eye chart. The correct answer is 3. Testing the 6 cardinal positions of gaze. Rationale. Testing the 6 cardinal positions of gaze is done to check for muscle weakness in the eyes. The client is asked to hold the head steady, then to follow movement of an object through the positions of gaze. The client should follow the object in a parallel manner with the 2 eyes. A Snellen eye chart checks visual acuity and cranial nerve 2. Testing sensory function by having the client close his or her eyes and then lightly touching areas of the face, and testing the corneal reflexes check cranial nerve 5 trigeminal. Question 6. The nurse notes that the physical assessment findings for a client with meningeal irritation indicate a positive Brudzinski sign. The nurse understands that which observation was made. 1. The client rigidly extends the arms with pronated forearms and plantar flexion of the feet. 2. The client flexes a leg at the hip and knee and reports pain in the vertebral column when the leg is extended. 3. The client passively flexes the hip and knee in response to neck flexion and reports pain in the vertebral column. 4. The client's upper arms are flexed and held tightly to the sides of the body, and the legs are extended and internally rotated. The correct answer is 3. The client passively flexes the hip and knee in response to neck flexion and reports pain in the vertebral column. Rationale: Brudzinski's sign is tested with the client in the supine position. The examiner flexes the client's head, and there should be no reports of pain or resistance to the neck flexion. A positive Brudzinski sign is observed if the client passively flexes the hip and knee in response to neck flexion and reports pain in the vertebral column. Koenig's sign also tests for meningeal irritation and is positive when the client flexes the legs at the hip and knee and complains of pain along the vertebral column when the leg is extended. Decerebrate posturing is abnormal extension and occurs when the arms are fully extended. Forearms pronated, wrists and fingers flexed, jaws clenched, neck extended, and feet plantar flexed. Decorticate posturing is abnormal flexion and is noted when the client's upper arms are flexed and held tightly to the sides of the body and the legs are extended and internally rotated. Question 7. A Spanish-speaking client arrives at the triage desk in the emergency department and states to the nurse, "No speak English, need interpreter." Which is the best action for the nurse to take? 1. Have one of the client's family members interpret. 2. Have the Spanish-speaking triage receptionist interpret. 3. Seek an interpreter from the hospital's interpreter services. 4. Obtain a Spanish-English dictionary and attempt to triage the client. The correct answer is 3. Seek an interpreter from the hospital's interpreter services. Rationale: the best action is to have a professional hospital-based interpreter translate for the client. English-speaking family members may not appropriately understand what is asked of them and may paraphrase what the client is actually saying. Also, client confidentiality as well as accurate information may be compromised when a family member or non-healthcare provider acts as interpreter. Question 8. The nurse is collecting data from a pregnant client when the client asks the nurse about the purpose of the fallopian tubes. Which is the accurate response the nurse should make? 1. Secrete progesterone. 2. Are where the fetus develops. 3. Are where fertilization occurs. 4. Secrete estrogen. The correct answer is 3. Are where fertilization occurs. Rationale: each fallopian tube is a hollow muscular tube that transports a mature oocyte for final maturation and fertilization. Fertilization typically occurs near the boundary between the ampulla and the isthmus of the tube. The fetus develops in the uterus. Estrogen is a hormone that is produced by the ovarian follicles, the corpus luteum, the adrenal cortex, and the placenta during pregnancy. Progesterone is a hormone that is secreted by the corpus luteum of the ovary, the adrenal glands, and the placenta during pregnancy. Question 9. The nursing instructor asks a nursing student to list the functions of the amniotic fluid. The student responds correctly by stating that which are functions of amniotic fluid. Select all that apply. 1. Allows for fetal movement. 2. Is a measure of kidney function. 3. Surrounds, cushions, and protects the fetus. 4. Maintains the body temperature of the fetus. 5. Prevents large particles, such as bacteria, from passing to the fetus. 6. Provides an exchange of nutrients and waste products between the mother and the fetus. The correct answers are 1. allows for fetal movement. 2, is a measure of kidney function. 3, surrounds, cushions, and protects the fetus. And 4, maintains the body temperature of the fetus. Rationale: the amniotic fluid surrounds, cushions, and protects the fetus. It allows the fetus to move freely. It maintains the body temperature of the fetus, and it helps to measure kidney function because the amount of fluid is based on the amount of urination from the fetus. The placenta prevents large particles such as bacteria from passing to the fetus, and it provides an exchange of nutrients and waste product between the mother and the fetus. Question 10. The nurse working in a prenatal clinic reviews a client's chart and notes that the healthcare provider documents that the client has a gynecoid pelvis. The nurse understands that which is a characteristic of this type of pelvis. 1. Not favorable for labor. 2. Not normally a female pelvis type. 3. A wide pelvis with a short diameter. 4. The most favorable for labor and birth. The correct answer is 4. The most favorable for labor and birth. Rationale: a gynecoid pelvis is a normal female pelvis, and it is the most favorable for successful labor and birth. An android pelvis would not be favorable for labor because of the narrow pelvic planes. An anthropoid pelvis has an outlet that is adequate with a normal or moderately narrow pubic arch. The platypelloid pelvis has a wide transverse diameter, but the anteroposterior diameter is short, thus making the outlet inadequate. Question 11. The client asks the nurse about the purpose of the placenta. The nurse plans to respond to the client knowing which about the placenta. 1. Cushions and protects the fetus. 2. Maintains the body temperature of the fetus. 3. Surround the fetus and allows for fetal movement. 4. Provides an exchange of nutrients and waste products between the mother and the fetus. The correct answer is 4. Provides an exchange of nutrients and waste products between the mother and the fetus. Rationale: the placenta provides an exchange of nutrients and waste products between the mother and the fetus. The amniotic fluid surrounds, cushions, and protects the fetus and allows for fetal movement. The amniotic fluid also maintains the body temperature of the fetus. Question 12. The nurse is describing the process of fetal circulation to a client during a prenatal visit. The nurse should tell the client that fetal circulation consists of which? 1. 2 umbilical veins and 1 umbilical artery. 2. 2 umbilical arteries and 1 umbilical vein. 3. Arteries that carry oxygenated blood to the fetus. 4. Veins that carry deoxygenated blood to the fetus. The correct answer is 2 umbilical arteries and 1 umbilical vein. Rationale: blood pumped by the fetus's heart leaves the fetus through 2 umbilical arteries. After the blood is oxygenated, it is then returned by 1 umbilical vein. Arteries carry deoxygenated blood and waste products from the fetus, and veins carry oxygenated blood and provide oxygen and nutrients to the fetus. Question 13. A nursing student is assigned to a client in labor. The nursing instructor asks the student to describe fetal circulation, specifically the ductus venosus. The instructor determines that the student understands the structure of the ductus venosus if the student states which about the ductus venosus. 1. Connects the pulmonary artery to the aorta. 2. Is an open between the right and left atria. 3. Connects the umbilical vein to the inferior vena cava. 4. Connects the umbilical artery to the inferior vena cava. The correct answer is 3. Connects the umbilical vein to the inferior vena cava. Rationale: the ductus venosus connects the umbilical vein to the inferior vena cava. The foramen ovale is a temporary opening between the right and left atria. The ductus arteriosus joins the aorta and the pulmonary artery. Question 14. During a prenatal visit, the nurse checks the fetal heart rate of a client in the 3rd trimester of pregnancy. The nurse determines that the FHR is normal if which heart rate is noted? 1. 80 beats per minute. 2. 100 beats per minute. 3. 150 beats per minute. 4. 180 beats per minute. The correct answer is 3. 150 beats per minute. Rationale: Fetal heart rate depends on gestational age. It is normally 160 to 170 beats per minute during the first trimester, but it slows with fetal growth to 110 to 160 beats per minute near or at term. Question 15. The nurse is reinforcing teaching to a pregnant woman about the physiological effects and hormone changes that occur during pregnancy. The woman asks the nurse about the purpose of estrogen. The nurse bases a response on which purpose of estrogen? 1. It maintains a uterine lining for implantation. 2. It stimulates the metabolism of glucose and converts glucose to fat. 3. It stimulates uterine development to provide an environment for the fetus and stimulates the breast to prepare for lactation. 4. It prevents the involution of the corpus luteum and maintains the production of progesterone until placenta is formed. The correct answer is 3. It stimulates uterine development to provide an environment for the fetus and stimulates the breast to prepare for lactation. Rationale: estrogen stimulates uterine development to provide an environment for the fetus, and it stimulates the breast to prepare for lactation. Progesterone maintains a uterine lining for implantation and relaxes all smooth muscle. Human placental lactogen stimulates the metabolism of glucose and converts the glucose to fat. Human chorionic gonadotropin prevents the involution of the corpus luteum and maintains the production of progesterone until placenta is formed. Question 16. The client arrives at the prenatal clinic for her first prenatal assessment. The client tells a nurse that the first day of her last menstrual period was October 20th, 2025. Using Nagel's rule, the nurse determines the estimated date of birth as which? 1. July 12th, 2026. 2. July 27th, 2026. 3. August 12th, 2026. 4. August 27th, 2026. The correct answer is 2. July 27th, 2026. Rationale: the accurate use of Nagel's rule requires that the woman have a regular 28-day menstrual cycle. Subtract 3 months from the first day of the last menstrual period, add 7 days, and then adjust the year as appropriate. In this case, the first day of the LMP was October 20th, 2025. When you subtract 3 months, you get July 20th, 2025. If you add 7 days, you get July 27th, 2025. Add 1 year to this, and you get the estimated date of birth, July 27th, 2026. Question 17. A pregnant client asks the nurse in the clinic when she will be able to start feeling the fetus move. The nurse responds by telling the mother that fetal movements will be noted between which weeks of gestation? 1. 6 and 8 weeks gestation. 2. 8 and 10 weeks gestation. 3. 10 and 12 weeks gestation. 4. 16 and 20 weeks gestation. The correct answer is 4. 16 and 20 weeks gestation. Rationale: quickening is fetal movement that usually first occurs between 16 and 20 weeks gestation. The expectant mother first notices subtle fetal movements during this time, and these gradually increase in intensity. Question 18. The nurse is collecting data from a client who is pregnant with twins. The client has a healthy 5-year-old child who was delivered at 38 weeks, and she tells the nurse that she does not have a history of any type of abortion or fetal demise. The nurse should document the GTPL for this client as which? 1. G equals 3, T equals 2, P equals 0, A equals 0, L equals 1. 2. G equals 2, T equals 1, P equals 0, A equals 0, L equals 1. 3. G equals 1, T equals 1, P equals 1, A equals 0, L equals 1. 4. G equals 2, T equals 0, P equals 0, A equals 0, L equals 1. The correct answer is 2. G equals 2, T equals 1, P equals 0, A equals 0, L equals 1. Rationale: pregnancy outcomes can be described with the GTPL acronym. G equals gravidity, number of pregnancies. T equals term births, number born after 37 weeks. P equals preterm births, number born before 37 weeks gestation. A equals abortion/miscarriages, number of abortion/miscarriages. L equals live births, number of live births or living children. Therefore, a woman who is pregnant with twins and who already has a child has a gravida of 2. Because the child was delivered at 38 weeks, the number of preterm births is 0, and the number of term births is 1. The number of abortions is 0, and the number of live births is 1. Question 19. The nurse is collecting data from a client who is pregnant with triplets. The client also has a 3-year-old child who was born at 39 weeks gestation. The nurse should document which gravida and para status on this client. 1. Gravida 1, para 1. 2. Gravida 2, para 1. 3. Gravida 2, para 2. For gravida 3, para 2. The correct answer is 2. Gravida 2, para 1. Rationale. Gravida is a term that refers to a woman who is or who has been pregnant, regardless of the duration of the pregnancy. Parity is a term that means a number of births after 20 weeks gestation. It does not reflect the number of fetuses or infants. Question 20. The nurse is reviewing the record of a client who has just been told that her pregnancy test is positive. The nurse notes that the healthcare provider has documented the presence of Goodell sign. The nurse determines that this sign is indicative of which? 1. A softening of the cervix. 2. The presence of fetal movement. 3. The presence of human chorionic gonadotropin in the urine. 4. A soft blowing sound that corresponds with the maternal pulse that is heard while auscultating the uterus. The correct answer is 1. A softening of the cervix. Rationale. During the early weeks of pregnancy, the cervix becomes softer as a result of pelvic vasoconstriction, which causes Goodell sign. Cervical softening is noted by the examiner during a pelvic examination. Goodell sign does not indicate the presence of fetal movement. Human chorionic gonadotropin is noted in maternal urine with a positive urine pregnancy test. A soft blowing sound that corresponds with a maternal pulse may be auscultated over the uterus. It is a result of blood circulating through placenta. Question 1. The nurse is assigned to assist with caring for a client who has a chest tube. The nurse notes fluctuations of the fluid level in the water-sealed chamber. Based on this observation, which action would be appropriate? 1. Empty the drainage. 2. Encourage the client to deep breathe. 3. Continue to monitor, because this is an expected finding. 4. Encourage the client to hold his or her breath periodically. The correct answer is 3. Continue to monitor, because this is an expected finding. Rationale. The presence of fluctuations in the fluid level in the water-sealed chamber indicates a patent drainage system with normal breathing. The water level rises with inspiration and falls with expiration. The apparatus and all connections must remain airtight at all times, and the drainage is never empty because of the risk of disruption in the closed system, which can result in lung collapse. Encouraging the client to deep breathe is unrelated to this observation. The client is not told to hold his or her breath. Question 2. The nurse is assigned to assist a healthcare provider with the removal of a chest tube. The nurse should reinforce instructing the client to do which during this process? 1. Stay very still. 2. Exhale forcefully. 3. Inhale and exhale quickly. 4. Perform Valsalva's maneuver. The correct answer is 4. Perform Valsalva's maneuver. Rationale. When the chest tube is removed, the client is asked to perform Valsalva's maneuver. The tube is quickly withdrawn and an airtight dressing is taped in place. An alternative instruction is to ask the client to take a deep breath and hold the breath while the tube is removed. Question 3. The nurse is preparing to begin a continuous tube feeding on a client with a nasogastric tube. In which position should the nurse place the client for safe administration of the tube feeding? 1. Supine. 2. Supine on the right side. 3. With the head elevated 15 degrees. 4. With the head elevated 45 degrees. The correct answer is 4. With the head elevated 45 degrees. Rationale. When a tube feeding is administered, the client is placed in a high Fowler's position for a bolus feeding and in a semi-Fowler's position, 30 to 45 degrees, for continuous feeding to allow gravity to help the flow of formula and to prevent reflux and aspiration. Question 4. The nurse is preparing to administer an intermittent tube feeding to a client with a nasogastric tube. The nurse checks the residual and obtains an amount of 200 milliliters. Which action should the nurse take? 1. Hold the feeding. 2. Administer the feeding. 3. Flush the tubing with 30 milliliters of water. 4. Elevate the head of the bed to 90 degrees and administer the feeding. The correct answer is 1. Hold the feeding. Rationale. When 200 milliliters of residual formula are obtained, the feeding is held because this is an indication that the feeding is not being absorbed. If the residual is less than 100 milliliters, the feeding is usually administered. Large volume aspirates indicate delayed gastric emptying and place the client at risk for aspiration. In addition, the nurse should always check the healthcare provider's prescriptions and agency policy regarding residual amounts. Elevating the head of the bed to 90 degrees and flushing the tubing are not appropriate actions. Question 5. The nurse is assisting in planning care for a client with a chest tube. The nurse should suggest to include which interventions and plan? Select all that apply. 1. Pin the tubing to the bed linens. 2. Be sure all connections remain airtight. 3. Be sure all connections are taped and secure. 4. Empty the drainage from the drainage collection chamber daily. 5. Monitor closely for tubing that is kinked or obstructed by the weight of the client. The correct answers are 2. Be sure all connections remain airtight. 3. Be sure all connections are taped and secure. And 5. Monitor closely for tubing that is kinked or obstructed by the weight of the client. Rationale. Chest tube tubing is never pinned to the bed linens because this presents the risk of accidental dislodgement of the tube when the client moves. The chest tube system is not open and empty because a closed system must be maintained. If the system is open, lung collapse can occur. Question 6. The nurse is assigned to care for a client who has a chest tube. The nurse is told to monitor the client for crepitus, subcutaneous emphysema. Which method should be used to monitor the client for crepitus? 1. Asking the client about pain. 2. Checking the respirations hourly. 3. Checking the blood pressure every 2 hours. 4. Palpating for the leakage of air into the subcutaneous tissues. The correct answer is 4. Palpating for the leakage of air into the subcutaneous tissues. Rationale. Subcutaneous emphysema is also known as crepitus. It presents as a puffed-up appearance that is caused by the leakage of air into the subcutaneous tissues. It is monitored by palpating, and it feels like bubble wrap when palpated. Although options 1, 2, and 3 may be components of the plan of care for a client with a chest tube, these actions will not identify subcutaneous emphysema. Question 7. The nurse is told that an assigned client will have a fenestrated tracheostomy tube inserted. The nurse should provide the client with which information about this type of tube? 1. Enables the client to speak. 2. Prevents the client from speaking. 3. Is necessary for mechanical ventilation. 4. Prevents air from being inhaled through the tracheostomy opening. The correct answer is 1. Enables the client to speak. Rationale. A fenestrated tube has a small opening in the outer cannula that allows some air to escape to the larynx. This type of tube enables the client to speak. Question 8. The nurse is preparing to administer medication through a nasogastric tube that is connected to suction, which indicates the accurate procedure for medication administration. 1. Position the client supine to assist with medication absorption. 2. Clamp the NG tube for 30 minutes after medication administration. 3. Aspirate the NG tube after medication administration to maintain patency. 4. Change the suction setting to low intermittent suction for 30 minutes after medication administration. The correct answer is 4. Change the suction setting to low intermittent suction for 30 minutes after medication administration. Rationale. If a client has an NG tube connected to suction, the nurse should wait up to 30 minutes before reconnecting the tube to the suction apparatus to allow adequate time for medication absorption. Aspirating the NG tube will remove the medication that has just been administered. Low intermittent suction will also remove the medication. The client should not be placed in the supine position because of the risk for aspiration. Question 9. The nurse is preparing to care for a dying client, and several family members are at the client's bedside. Which therapeutic techniques should the nurse use when communicating with the family? Select all that apply. 1. Discourage reminiscing. 2. Make the decision for family. 3. Encourage expression of feelings, concerns, and fears. 4. Explain everything that is happening to all family members. 5. Touch and hold the client's or family member's hand, if appropriate. 6. Be honest and let the client and family know that they will not be abandoned by the nurse. The correct answers are 3. Encourage expression of feelings, concerns, and fears. 5. Touch and hold the client's or family member's hand, if appropriate. And 6. Be honest and let the client and family know that they will not be abandoned by the nurse. Rationale. The nurse must determine whether there is a spokesperson for family and how much the client and family want to know. The nurse needs to allow the family and client the opportunity for informed choices and assist with the decision-making process if asked. The nurse should encourage expression of feelings, concerns, and fears and reminiscing. The nurse needs to be honest and let the client and family know that they will not be abandoned. The nurse should touch and hold the client's or family member's hand, if appropriate. Question 10. Upon palpation of the fontanelle of a 3-month-old newborn, the nurse notes that the anterior fontanelle has not closed and is soft and flat. Which action should the nurse take? 1. Increase oral fluids. 2. Document the findings. 3. Notify the HCP. 4. Elevate the head of the bed to 90 degrees. The correct answer is 2. Document the findings. Rationale. The anterior fontanelle is diamond-shaped and located on the top of the head. It should be soft and flat in a normal infant, and it normally closes by 12 to 18 months of age. The posterior fontanelle closes by 2 to 3 months of age. Therefore, because the findings are normal, the nurse should document the findings. Question 11. When caring for a 3-year-old child, the nurse should provide which toy for the child? 1. A puzzle. 2. A wagon. 3. A golf set. 4. A farm set. The correct answer is 2. A wagon. Rationale. Toys for the toddler must be strong, safe, and too large to swallow or place in the ear or nose. Toddlers need supervision at all times. Push-pull toys, large balls, large crayon trucks, and dolls are some appropriate toys. A puzzle with large pieces only may be appropriate. A farm set and a golf set may contain items that the child could swallow. Question 12. The nurse is caring for a 5-year-old child who has been placed in traction after a fracture of the femur. Which is the most appropriate activity for this child? 1. Blocks. 2. A puzzle. 3. A music video. 4. Large picture books. The correct answer is 2. A puzzle. Rationale. In the preschooler, play is simple and imaginative and includes activities such as dressing up, paints, crayons, and simple board and card games. Puzzles are also appropriate and aid with fine motor development. Blocks are most appropriate for the toddler. A music video is most appropriate for the adolescent. Large picture books are most appropriate for the infant. Question 13. An older client has been prescribed digoxin. The nurse understands that which age-related change would place the client at risk for digoxin toxicity? 1. Decreased cough efficiency and vital capacity. 2. Decreased salivation and gastrointestinal motility. 3. Decreased muscle strength and loss of bone density. 4. Decreased lean body mass and glomerular filtration rate. The correct answer is 4. Decreased lean body mass and glomerular filtration rate. Rationale. The older client is at risk for medication toxicity because of decreased lean body mass and an age-associated decreased glomerular filtration rate. although options 1, 2, and 3 identify age-related changes that occur in the older client. They are not specifically associated with this risk. Question 14. Which data indicates to the nurse that a client may be experiencing ineffective coping following the loss of her spouse? 1. Constantly neglects personal grooming. 2. Visits her husband's grave once a month. 3. Visits the senior citizens center once a month. 4. Frequently looks at snapshots of her husband and family. The correct answer is 1. Constantly neglects personal grooming. Rationale. Coping mechanisms are behaviors that are used to decrease stress and anxiety. In response to a death, ineffective coping is manifested by an extreme behavior that in some instances may be harmful to the individual physically, psychologically, or both. Option 1 is indicative of a behavior that identifies an ineffective coping behavior as part of the grieving process. The remaining options identify effective coping behaviors. Question 15. The nurse is preparing to communicate with an older client who is hearing impaired. Which intervention should be implemented initially? 1. Stand in front of client. 2. Exaggerate the lip movements. 3. Obtain a sign language interpreter. 4. Pantomime and write the client notes. The correct answer is 1. Stand in front of client. Rationale. The nurse would ensure that the hearing-impaired client can see the nurse when the nurse is speaking by providing adequate lighting and standing in front of the client. The nurse should enunciate words clearly but not exaggerate lip movements. If the client is profoundly hearing-impaired and uses signing, a sign language interpreter should be obtained. If a client cannot understand by reading lips, the nurse would try using gestures, pantomiming, or writing notes. Question 16. Which intervention should be implemented for the older client with presbycusis who has a hearing loss? 1. Speak louder. 2. Speak more slowly. 3. Use low-pitched tones. 4. Use high-pitched tones. The correct answer is 3. Use low-pitched tones. Rationale. Presbycusis refers to the age-related, irreversible, degenerative changes of the inner ear that lead to decreased hearing acuity. As a result of these changes, the older client has a decreased response to high-frequency sounds. Low-pitched tones of voice are more easily heard and interpreted by the older client. Speaking softly or slowly is not helpful. Question 17. When the nurse is collecting data from the older adult, which findings should be considered normal physiological changes? Select all that apply. 1. Increased heart rate. 2. Decline in visual acuity. 3. Decreased respiratory rate. 4. Decline in long-term memory. 5. Increased susceptibility to urinary tract infections. 6. Increased incidence of awakening after sleep onset. The correct answers are 2. Decline in visual acuity. 5. Increased susceptibility to urinary tract infections. And 6. Increased incidence of awakening after sleep onset. Rationale. Anatomical changes to the eye affect the individual's visual ability, which leads to potential problems with activities of daily living. Light adaptation and visual fields are reduced. Respiratory rates are usually unchanged. The heart rate decreases and the heart valves thicken. Age-related changes that affect the urinary tract increase in older clients' susceptibility to urinary tract infections. Short-term memory may decline with age, but long-term memory is usually maintained. Changes in sleep patterns are consistent. Age-related changes. Older persons experience an increased incidence of awakening after sleep onset. Question 18. The nurse is planning to feed an older client who is at risk for aspiration of food. During the meal, how should the nurse position the client? 1. Upright in a chair. 2. On the left side in bed. 3. On the right side in bed. 4. In a low fowler's position with the legs elevated. The correct answer is 1. Upright in a chair. Rationale. It is preferable to get clients out of bed and sitting in a chair for meals. This position facilitates chewing and swallowing and prevents the reflux of stomach contents and aspiration. Question 19. The clinic nurse is assisting to perform a focused data collection process on a client who is complaining of symptoms of a cold, a cough, and lung congestion. Which should the nurse include for this type of data collection? Select all that apply. 1. Auscultating lung sounds. 2. Obtaining the client's temperature. 3. Checking the strength of peripheral pulses. 4. Obtaining information about the client's respirations. 5. Performing a musculoskeletal and neurological examination. 6. Asking the client about a family history of any illness or disease. The correct answers are 1. Auscultating lung sounds. 2. Obtaining the client's temperature. And 4. Obtaining information about the client's respirations. Rationale. A focused data collection process focuses on a limited or short-term problem, such as a client's complaint. Because the client is complaining of symptoms of a cold, a cough, and lung congestion, the nurse would focus on the respiratory system and the presence of an infection. A complete data collection includes a complete health history and physical examination and forms a baseline database. Checking the strength of peripheral pulses relates to a vascular assessment, which is not related to this client's complaints. A musculoskeletal and neurological examination also is not related to this client's complaints. However, strength of peripheral pulses and a musculoskeletal and neurological examination would be included in a complete data collection. Likewise, asking the client about a family history of any illness or disease would be included in a complete assessment. Question 20. A client with a diagnosis of asthma is admitted to the hospital with respiratory distress. Which type of adventitious lung sounds should the nurse expect to note documented in the health record when collecting data related to the respiratory system for this client? 1. Stridor. 2. Wheezes. 3. Diminished. 4. Pleural friction rub. The correct answer is 2. Wheezes. Rationale. Asthma is a respiratory disorder characterized by recurring episodes of dyspnea, constriction of the bronchi, and wheezing. Wheezes are described as high-pitched musical sounds heard when air passes through an obstructed or narrowed lumen of a respiratory passageway. Stridor is a harsh sound noted with an upper airway obstruction and often signals a life-threatening emergency. Diminished lung sounds are heard over lung tissue where poor oxygen exchange is occurring. A pleural friction rub is heard in individuals with pleurisy. Question 1. A client arrives to the surgical nursing unit after surgery. What should be the initial nursing action after surgery? 1. Patency of the airway. 2. Dressing for bleeding. 3. Tubes or drains for patency. 4. Vital signs to compare with preoperative measurements. The correct answer is 1. Patency of the airway. Rationale. If the airway is not patent, immediate measures must be taken for the survival of the client. After checking the client's airway, the nurse would then check the client's vital signs, and this would be followed by checking the dressings, tubes, and drains. Question 2. The nurse is monitoring an adult client for postoperative complications, which is most indicative of a potential postoperative complication that requires further observation. 1. A urinary output of 20 milliliters per hour. 2. A temperature of 37.6 degrees Celsius, 99.6 degrees Fahrenheit. 3. A blood pressure of 100/70. 4. Serous drainage on the surgical dressing. The correct answer is 1. A urinary output of 20 milliliters per hour. Rationale. Urine output is maintained at a minimum of at least 30 milliliters per hour for an adult. An output of less than 30 milliliters per hour for each of 2 consecutive hours should be reported to the surgeon. A temperature more than 37 degrees Celsius, 100 degrees Fahrenheit, or less than 36.1 degrees Celsius, 97 degrees Fahrenheit, and a falling systolic blood pressure less than 90 are to be reported. The client's preoperative or baseline blood pressure is used to make informed postoperative comparisons. Moderate or light serous drainage from the surgical site is considered normal. Question 3. The nurse monitors the postoperative client frequently, knowing that accumulated secretions can lead to which problem? 1. Pneumonia. 2. Fluid imbalance. 3. Pulmonary edema. 4. Carbon dioxide retention. The correct answer is 1. Pneumonia. Rationale. The most common postoperative respiratory problems are atelectasis pneumonia and pulmonary emboli. Pneumonia is the inflammation of lung tissue that causes a productive cough, dyspnea, and crackles. Fluid imbalance can be a deficit or excess related to fluid loss or overload. Pulmonary edema usually results from left-sided heart failure, and it can be caused by medications, fluid overload, and smoke inhalation. Carbon dioxide retention results from the inability to exhale carbon dioxide in clients with conditions such as chronic obstructive pulmonary disease. Question 4. The nurse is caring for a postoperative client who has a drain inserted into the surgical wound. Which action should the nurse avoid in the care of the drain? 1. Check the drain for patency. 2. Observe for bright red, bloody drainage. 3. Maintain aseptic technique when emptying. 4. Secure the drain by curling or folding it and taping it firmly to the body. The correct answer is 4. Secure the drain by curling or folding it and taping it firmly to the body. Rationale. Aseptic technique must be used when emptying the drainage container or changing the dressing to avoid contamination of the wound. Usually drainage from the wound is pale, red, and watery, whereas active bleeding will be bright red in color. The drain should be checked for patency to provide an exit for fluid or blood to promote healing. The nurse needs to ensure that drainage flows freely and that there are no kinks in the drains. Curling or folding the drain prevents the flow of the drainage. Question 5. The nurse checks the client's surgical incision for signs of infection, which is indicative of a potential infection. 1. The presence of serous drainage. 2. The presence of purulent drainage. 3. A temperature of 98.8 degrees Fahrenheit. 4. The client complaining of feeling cold. The correct answer is 2. The presence of purulent drainage. Rationale. Signs and symptoms of wound infection include warm, red, and tender skin around the incision. The client may have fever and chills. Purulent material may exit from drains or from separated wound edges. Infection may be caused by poor aseptic technique or a wound that was contaminated before surgical exploration. It appears 3 to 6 days after surgery. Serous drainage is not indicative of a wound infection. A temperature of 98.8 degrees Fahrenheit is not an abnormal finding in a postoperative client. The fact that a client feels cold is not indicative of an infection, although chills and fever are signs of infection. Question 6. The nurse is assigned to assist with caring for a client after cardiac catheterization. The nurse should plan to maintain bed rest for this client in which position? 1. High Fowler's position. 2. Lateral position. 3. Head elevation of 45 degrees. 4. Head elevation of no more than 30 degrees. The correct answer is 4. Head elevation of no more than 30 degrees. Rationale. After cardiac catheterization, the extremity into which the catheter was inserted is kept straight for prescribed time period. The client may turn from side to side. The client is placed in the supine position, and the head of the bed is not elevated to more than 30 degrees to keep the affected leg straight at the groin and prevent arterial occlusion. Bathroom privileges are not allowed during the immediate post-catheterization period. Question 7. The nurse is reinforcing home care instructions to a client and family regarding care after cataract removal from the right eye. Which statement made by the client indicates an understanding of the instructions? 1. I should not sleep on my left side. 2. I should not sleep on my right side. 3. I will take aspirin if I have any pain. 4. I should not wear my glasses until my surgeon says it's okay. The correct answer is 2. I should not sleep on my right side. Rationale. After cataract surgery, the client should not sleep on the side of the body that was operated on. Clients should be instructed not to take aspirin or any medications that contain aspirin because of their antiplatelet properties that can increase the risk of bleeding. Acetaminophen can be taken as needed for pain. Clients may wear their glasses. Question 8. After a liver biopsy, the nurse should place the client in which position? 1. Trendelenburg and on the left side. 2. Prone with the head of the bed in a flat position. 3. Supine with the head of the bed at a 30-degree angle. 4. A right sideline position with a small pillow or folded towel under the puncture site. The correct answer is 4. A right sideline position with a small pillow or folded towel under the puncture site. Rationale. After a liver biopsy, the client is assisted with assuming a right sideline position with a small pillow or folded towel under the puncture site for at least 3 hours. Options 1, 2, and 3 are incorrect positions. Question 9. The nurse is administering a cleansing enema to a client with a fecal impaction. Before administering the enema, the nurse should assist the client to which position? 1. Left Sims position with the head of the bed flat. 2. Right Sims position with the head of the bed elevated 15 to 30 degrees. 3. On the left side of the body with the head of the bed elevated 45 degrees. 4. On the right side of the body with the head of the bed elevated 45 degrees. The correct answer is 1. Left Sims position with the head of the bed flat. Rationale. When administering an enema, the client is placed in a left Sims position so that the enema solution can flow by gravity in the natural direction of the colon. The head of the bed is not elevated. Question 10. A client is being prepared for a thoracentesis. The nurse should assist the client to which position for procedure? 1. Sims position with the head of the bed flat. 2. Prone, with the head turned to the side supported by a pillow. 3. Lie in bed on the affected side, with the head of the bed elevated 45 degrees. 4. Lying in bed on the unaffected side, with the head of the bed elevated 45 degrees. The correct answer is 4. Lying in bed on the unaffected side, with the head of the bed elevated 45 degrees. Rationale. To facilitate the removal of fluid from the chest, the client is positioned sitting on the edge of the bed, leaning over a bedside table, with the feet supported on a stool, or lying in bed on the unaffected side, with the head of the bed elevated 45 degrees. Options 1, 2, and 3 are incorrect. Question 11. The nurse is assisting with the insertion of a nasogastric tube into a client. The nurse should place the client in which position for insertion? 1. Right side. 2. Low Fowler's position. 3. High Fowler's position. 4. Supine with the head flat. The correct answer is 3. High Fowler's position. Rationale. During the insertion of a nasogastric tube, the client is placed in a sitting or high Fowler's position to reduce the risk of pulmonary aspiration if the client should vomit. Options 1, 2, and 4 do not facilitate the insertion of the tube or prevent aspiration. Nursing question 12. The nurse is assisting with caring for a client after a craniotomy. Which is the best position for the client to be placed? 1. Prone position. 2. Supine position. 3. Semi-Fowler's position. 4. Dorsal recumbent position. The correct answer is 3. Semi-Fowler's position. Rationale. After a craniotomy, the head of the bed is elevated 30 to 45 degrees, semi-Fowler's to Fowler's position, and the client's head is maintained in a midline, neutral position to facilitate venous drainage. Options 1, 2, and 4 are incorrect positions. Question 13. The nurse is turning a postoperative client who had extensive spinal surgery on the previous day. Which turning intervention or position would be best for repositioning this client? 1. Log rolling. 2. Semi-Fowler's. 3. Sims. 4. 30-degree lateral. The correct answer is 1. Log rolling. Rationale. Log rolling is used to maintain neck and spinal alignment after injury or surgery. A minimum of 3 to 4 staff members is recommended to prevent injury to the client, and a draw or pull sheet is also suggested. Options 2, 3, and 4 do not maintain proper spinal alignment and could be harmful. Nursing question 14. The nurse is preparing to administer an intermittent tube feeding to a client. The nurse aspirates 90 milliliters of residual from the tube. What should the nurse do with the aspirated residual? 1. Hold the feeding. 2. Place it into a container for laboratory analysis. 3. Rain still the residual and administer the feeding. 4. Deduct the amount of the residual from a new feeding and administer that amount to the client. The correct answer is 3. Reinstill the residual and administer the feeding. Rationale: unless otherwise instructed or if the residual contents appear abnormal, an amount of less than 100 milliliters may be reinstituted. Then a normal amount of prescribed tube feeding is administered. It is important to return the contents to the stomach to prevent electrolyte imbalances. Therefore, options 1, 2, and 4 are incorrect. Nursing question 15. The nurse is providing endotracheal suctioning to a client who is mechanically ventilated when the client becomes restless and tachycardic. Which action should the nurse take? 1. Notify the rapid response team. 2. Finish the suctioning as quickly as possible. 3. Contact the respiratory department to suction the client. 4. Discontinue suctioning until the client is stabilized and monitor vital signs. The correct answer is 4. Discontinue suctioning until the client is stabilized and monitor vital signs. Rationale: if a client becomes cyanotic or restless or develops tachycardia, bradycardia, or another abnormal heart rhythm, the nurse must discontinue suctioning until client is stabilized. It is also important to monitor the vital signs and the pulse oximetry. If the client's condition continues to deteriorate, then the respiratory department and healthcare provider may need to be notified. There is no data in the question that indicates that the rapid response team needs to be notified. Nursing question 16. The nurse is checking a client for the correct placement of a nasogastric tube. The nurse aspirates the client's stomach contents and checks its pH level. Which pH value indicates the correct placement of the tube? 1. 3.5. 2. 4.5. 3. 6.0. 4. 7.35. The correct answer is 1. 3.5. Rationale: if the NG tube is in the stomach, the pH of the contents will be acidic. Options 2 and 3 indicate a slightly acidic pH. Option 4 indicates a neutral pH. Question 17. A staff nurse is preparing to assist a charge nurse with removing a nasogastric tube from a client. The staff nurse should reinforce, instructing the client to perform which action? 1. Exhale. 2. Inhale and exhale quickly. 3. Take and hold a deep breath. 4. Perform Valsalva's maneuver. The correct answer is 3. Take and hold a deep breath. Rationale: when the NG tube is removed, the client is instructed to take and hold a deep breath. This will close the epiglottis, and the airway will be temporarily obstructed during the tube removal. This allows for the easy withdrawal of the tube through the esophagus into the nose. The tube is removed with one very smooth, continuous pull. Options 1, 2, and 4 are incorrect. Question 18. The nurse is assisting with monitoring the functioning of a chest tube drainage system in a client who just returned from the recovery room after a thoracotomy with wedge resection. Which findings should the nurse expect to note? Select all that apply. 1. Vigorous bubbling in the suction control chamber. 2. 50 milliliters of drainage in the drainage collection chamber. 3. The drainage system is maintained below the client's chest. 4. An occlusive dressing is in place over the chest tube insertion site. 5. Fluctuation of water in the tube of the water seal chamber during inhalation and exhalation. The correct answers are 2. 50 milliliters of drainage in the drainage collection chamber. 3. The drainage system is maintained below the client's chest. 4. An occlusive dressing is in place over the chest tube insertion site. And 5. Fluctuation of water in the tube of the water seal chamber during inhalation and exhalation. Rationale: the bubbling of water in the water seal chamber indicates air drainage from the client. This is usually seen when intrathoracic pressure is greater than atmospheric pressure, and it may occur during exhalation, coughing, or sneezing. Excessive bubbling in the water seal chamber may indicate an air leak, which is an unexpected finding. The fluctuation of water in the tube in the water seal chamber during inhalation and exhalation is expected. An absence of fluctuation may indicate that the chest tube is obstructed, the lung has re-expanded, or no more air is leaking into the pleural space. Gentle, not vigorous. Bubbling should be noted in the suction control chamber. A total of 50 milliliters of drainage is not excessive in a client returning to the nursing unit from the recovery room. However, drainage of more than 70 to 100 milliliters per hour is considered excessive and requires healthcare provider notification. The chest tube insertion site is covered with an occlusive dressing to prevent air from entering the pleural space. Positioning the drainage system below the client's chest allows gravity to drain the pleural space. Question 19. The nurse is assigned to assist with caring for a client with esophageal varices who had a Sengstaken-Blakemore tube inserted because other treatment measures were unsuccessful. The nurse should check the client's room to ensure that which priority item is at the bedside. 1. An obturator. 2. A Kelly clamp. 3. An irrigation set. 4. A pair of scissors. The correct answer is 4. A pair of scissors. Rationale. When the client has a Sengstaken-Blakemore tube, a pair of scissors must be kept at the client's bedside at all times. The client needs to be observed for sudden respiratory distress, which occurs if the gastric balloon ruptures and the entire tube moves upward. If this occurs, balloon lumens will be cut. An obturator and a Kelly clamp are kept at the bedside of the client with a tracheostomy. An irrigation set may also be kept at the bedside, but it is not the priority item. Question 20. The nurse is inserting an indwelling urinary catheter into a male client. As the catheter is inserted into the urethra, urine begins to flow into the tubing. The nurse should take which step next? 1. Immediately inflate the balloon. 2. Insert the catheter 2.5 to 5 centimeters and inflate the balloon. 3. Insert the catheter until resistance is met and inflates the balloon. 4. Withdraw the catheter approximately 1 inch and inflate the balloon. The correct answer is 2. Insert the catheter 2.5 to 5 centimeters and inflate the balloon. Rationale. The catheter's balloon is behind the opening at the insertion tip. The catheter is inserted 2.5 to 5 centimeters after urine begins to flow to provide sufficient space to inflate the balloon. Inserting the catheter the extra distance will ensure that the balloon is inflated inside the bladder and not in the urethra, which could produce trauma. Inserting the catheter until resistance is met could cause trauma to the bladder wall. Question 1. The nurse is caring for a client with a healthcare associated infection caused by methicillin-resistant Staphylococcus aureus, who is on contact precautions. The nurse prepares to provide colostomy care to the client. Which protective items will be required to perform this procedure? 1. Gloves and a gown. 2. Gloves and goggles. 3. Gloves, a gown, and goggles. 4. Gloves, a gown, and shoe protectors. The correct answer is 3. Gloves, a gown, and goggles. Rationale. Goggles are worn to protect the mucous membranes of the eye during interventions that may produce splashes of blood, body fluids, secretions, and excretions. In addition, contact precautions require the use of gloves, and a gown should be worn if direct client contact is anticipated. Shoe protectors are not necessary. Question 2. The nurse should institute which type of precaution for a client diagnosed with Clostridium difficile? 1. Droplet. 2. Contact. 3. Airborne. 4. Neutropenic. The correct answer is 2. Contact. Rationale. Contact precautions are necessary for colonization or infection with a multi-drug-resistant organism. This includes enteric infection with Clostridium difficile. Droplet or airborne precautions are not necessary because the organism is not transferred via the respiratory route. Neutropenic precautions are used when the client needs protection from contracting an infection from others. Question 3. The nurse enters a client's room and finds that the wastebasket is on fire. The nurse immediately assists the client out of the room. Which is the next nursing action? 1. Call for help. 2. Extinguish the fire. 3. Activate the fire alarm. 4. Confine the fire by closing the room door. The correct answer is 3. Activate the fire alarm. Rationale. The order of priority in the event of fire is to rescue the clients who are in immediate danger. The next step is to activate the fire alarm. The fire is then confined by closing all doors. Finally, the fire is extinguished. Question 4. The community health nurse has completed a teaching session about anthrax with members of the community. The nurse reinforcing the teaching tells those attending that anthrax can be transmitted via which routes? Select all that apply. 1. Skin. 2. Kissing. 3. Inhalation. 4. Gastrointestinal. 5. Direct contact with an infected individual. The correct answers are 1. Skin, 3. Inhalation, and 4. Gastrointestinal. Rationale. Anthrax is caused by Bacillus anthracis, and it can be contracted through the digestive system, abrasions in the skin, or inhalation. It cannot be spread from person to person. Question 5. The nurse obtains a prescription from a healthcare provider to restrain a client using a jacket restraint and instructs the unlicensed assistive personnel to apply the restraint, which observation, if made by the nurse, should indicate unsafe application of the restraint. 1. A safety knot is made in the restraint strap. 2. The restraint straps are safely secured to the side rails. 3. The jacket restraint strap does not tighten when force is applied against it. 4. The jacket restraint is secure, and 2 fingers can easily slide between the restraint and the client's skin. The correct answer is 2. The restraint straps are safely secured to the side rails. Rationale. A half bow or safety knot should be used when applying restraint, because it does not tighten when force is applied against it and allows for the quick and easy removal of the restraint in case of an emergency. The restraint strap is secured to the bed frame, never to the side rail, to avoid accidental injury in case the side rail is released. The jacket restraint should be secure, and 1 to 2 fingers should easily slide between the restraint and the client's skin. Question 6. The nurse is caring for a client who has hand restraints. How often should the nurse assess the skin integrity of the restrained hands? 1. Every 2 hours. 2. Every 3 hours. 3. Every 4 hours. 4. Every 30 minutes. The correct answer is 4. Every 30 minutes. Rationale. The nurse needs to assess restraints and skin integrity every 30 minutes. Therefore, options 1, 2, and 3 are incorrect. Agency guidelines regarding the use of restraints should always be followed. Question 7. The nurse is assisting with planning care for a client with an internal radiation implant, which should be included in the plan of care. Select all that apply. 1. Wearing gloves when emptying the client's bedpan. 2. Keeping all linens in the room until the implant is removed. 3. Wearing a film dosimeter badge when in the client's room. 4. Wearing a lead apron when providing direct care to client. 5. Placing the client in a semi-private room at the end of the hallway. The correct answers are 1. Wearing gloves when emptying the client's bedpan. 2. Keeping all linens in the room until the implant is removed. 3. Wearing a film badge when in the client's room. And 4. Wearing a lead apron when providing direct care to the client. Rationale. A private room with a private bath is essential if a client has an internal radiation implant. This is necessary to prevent the accidental exposure of other clients to radiation. The remaining options identify interventions that are necessary for a client with a radiation device. Question 8. The nurse enters a nursing lounge and discovers that a chair is on fire. The nurse activates the alarm, closes a lounge door, and obtains a fire extinguisher to extinguish the fire. The nurse pulls the pin on the fire extinguisher. Which is the next action the nurse should perform? 1. Aim at the base of the fire. 2. Squeeze a handle on the extinguisher. 3. Sweep the fire from side to side with the extinguisher. 4. Sweep the fire from top to bottom with the extinguisher. The correct answer is 1. Aim at the base of the fire. Rationale. A fire can be extinguished by using a fire extinguisher. To use the extinguisher, the pin is pulled first. The extinguisher should then be aimed at the base of the fire. The handle of the extinguisher is squeezed, and the fire is extinguished by sweeping from side to coat the area evenly. Question 9. The nursing instructor asks a nursing student to describe the procedure for relieving an airway obstruction on an unconscious pregnant woman at 8 months gestation. How should the student describe the procedure correctly? 1. Place the hands in the pelvis to perform the thrusts. 2. Perform abdominal thrusts until the object is dislodged. 3. Perform left lateral abdominal thrusts until the object is dislodged. 4. Place a roll blanket under the right abdominal flank and hip area. The correct answer is 4. Place a roll blanket under the right abdominal flank and hip area. Rationale: to relieve an airway obstruction on an unconscious woman in an advanced stage of pregnancy, the woman is placed on her back. A wedge, such as a pillow or roll blanket, is placed under the right abdominal flank and hip to displace the uterus to the left side of the abdomen. Options 1, 2, and 3 are incorrect and can cause harm to the woman and the fetus. Question 10. The nurse on the day shift walks into a client's room and finds a client unresponsive. The client is not breathing and does not have a pulse, and the nurse immediately calls out for help. The next nursing action is which? 1. Deliver breaths. 2. Give the client oxygen. 3. Start chest compressions. 4. Ventilate with a mouth-to-mask device. The correct answer is 3. Start chest compressions. Rationale: the nurse would follow CAB, compressions, airway, and breathing. Therefore, the next nursing action would be to start chest compressions. Question 11. The nurse witnesses a neighbor's husband sustain a fall from the roof of his house. The nurse rushes to the victim and determines the need to open the airway. The nurse opens the airway in this victim with the use of which method? 1. Flex position. 2. Head tilt, chin lift. 3. Jaw thrust maneuver. 4. Modified head tilt, chin lift. The correct answer is 3. Jaw thrust maneuver. Rationale: if a neck injury is suspected, the jaw thrust maneuver is used to open the airway. The head tilt, chin lift produces hyperextension of the neck and could cause complications if a neck injury is present. A flex position is an inappropriate position for opening the airway. Question 12. The nurse is performing cardiopulmonary resuscitation, CPR, on an infant when performing chest compressions, which is compression rate for an infant. 1. 60 times per minute. 2. 80 times per minute. 3. 100 times per minute. 4. 160 times per minute. The correct answer is 3. 100 times per minute. Rationale: for an infant, the rate of chest compressions is at least 100 per minute. Options 1 and 2 identify rates that are too low, and option 4 identifies a rate that is too high. Question 13. The nurse attempts to relieve an airway obstruction on a 6-year-old conscious child. Which location is the correct placement of the hands to perform this maneuver? 1. Between the groin and the abdomen. 2. Between the umbilicus and the groin. 3. Between the lower abdomen and the chest. 4. Between the umbilicus and the xiphoid process. The correct answer is 4. Between the umbilicus and the xiphoid process. Rationale: to relieve an airway obstruction in a child, the rescuer stands behind the victim and places the arms directly under the victim's axilla and around the victim. The rescuer places the thumb side of one fist against the victim's abdomen in the midline slightly above the umbilicus and well below the tip of the xiphoid process. The rescuer grasps the fist with the other hand and delivers up to 5 thrusts. One must take care not to touch the xiphoid process or the lower margins of the rib cage, because force applied to these structures may damage the internal organs. Options 1, 2, and 3 are incorrect hand placements. Question 14. Which is the most appropriate location for assessing the pulse of an infant who is less than 1 year old? 1. Radial. 2. Carotid. 3. Brachial. 4. Popliteal. The correct answer is 3. Brachial. Rationale: To assess a pulse in an infant, the pulse is checked at the brachial artery. Femoral artery can also be used. The infant's relatively short. Fat neck makes palpation of the carotid artery difficult. The popliteal and radial pulses are also difficult to palpate in an infant. Question 15. The nurse educator is teaching principles of cardiopulmonary resuscitation to a group of nursing students. The nurse asks the student to describe the reason why blind finger sweeps are avoided in infants. The nurse determines that the student understands the reason if the student makes which statement? 1. The object may have been swallowed. 2. The infant may bite down on the finger. 3. The mouth is too small to see the object. 4. The object may be forced back further into the throat. The correct answer is 4. The object may be forced back further into the throat. Rationale. Blind finger sweeps are not recommended for infants and children because of the risk of forcing the object further down into the airway. Options 1, 2, and 3 are not related directly to the subject of the question. Question 16. The nurse is performing cardiopulmonary resuscitation, CPR, on an adult client. How far should the sternum be depressed in an adult client for effective chest compressions? 1. 1 inch. 2. 0.75 inch. 3. 2 inches. 4. 3 inches. The correct answer is 3. 2 inches. Rationale. When performing CPR on an adult client, the sternum is depressed 2 inches. Options 1 and 2 identify compression depths that will be ineffective for an adult, and option 4 identifies a depth that could cause injury to the client. Question 17. The nurse is developing a plan of care for a client who is scheduled for surgery. The nurse should include which activity in the nursing care plan for the client on the day of surgery? 1. Have the client void immediately before surgery. 2. Avoid oral hygiene and rinsing with mouthwash. 3. Verify that the client has not eaten for the last 24 hours. 4. Report immediately any slight increase in blood pressure or pulse. The correct answer is 1. Have the client void immediately before surgery. Rationale. The nurse should assist the client with voiding immediately before surgery so that the bladder will be empty. Oral hygiene is allowed, but the client should not swallow any water. The client usually has a restriction of food and fluids for 8 hours before surgery rather than 24 hours. A slight increase in blood pressure and pulse is common during the preoperative period. This is generally the result of anxiety. Question 18. The nurse is caring for a client who is scheduled for surgery. The client is concerned about the surgical procedure. Which action should alleviate the client's fears and misconceptions about surgery? 1. Tell the client that preoperative fear is normal. 2. Explain all nursing care and possible discomfort that may result. 3. Ask the client to discuss information known about the planned surgery. 4. Provide explanations about the procedures involved in the planned surgery. The correct answer is 3. Ask the client to discuss information known about the planned surgery. Rationale. Explanations should begin with the information that the client knows. Option 1 is a block to communication, and options 2 and 4 may produce additional anxiety in the client. Question 19. The nurse is collecting data from a client who is scheduled for surgery in 1 week in the ambulatory care surgical center. The nurse notes that the client has a history of arthritis and has been taking acetylsalicylic acid aspirin. The nurse reports the information to the healthcare provider and anticipates that the provider will prescribe which? 1. Discontinue the aspirin immediately. 2. Continue to take the aspirin as prescribed. 3. Discontinue the aspirin 48 hours before the scheduled surgery. 4. Decrease the dose of the aspirin to half of what is normally taken. The correct answer is 3. Discontinue the aspirin 48 hours before the scheduled surgery. Rationale. Anticoagulants alter normal clotting factors and increase the risk of bleeding after surgery. Aspirin has properties that can alter the clotting mechanism and should be discontinued at least 48 hours before surgery. However, the client should always check with his or her healthcare provider regarding when to stop taking the aspirin when a surgical procedure is scheduled. Therefore, the remaining options are incorrect. Question 20. The nurse obtains vital signs on a postoperative client who just returned to the nursing unit. The client's blood pressure is 100/60, the pulse is 90 beats per minute, and the respiration rate is 20 breaths per minute. On the basis of these findings, which nursing action should be performed? 1. Shake the client gently to arouse. 2. Continue to monitor the vital signs. 3. Call the HCP immediately. 4. Cover the client with a warm blanket. The correct answer is 2. Continue to monitor the vital signs. Rationale: a slightly lower than normal BP and an increased pulse rate are common after surgery. The level of consciousness can be determined by checking the client's response to light touch and verbal stimuli, rather than by shaking the client. Warm blankets are applied to maintain the client's body temperature. There is no reason to contact the HCP immediately. Question 1. A clear liquid diet has been prescribed for a client with gastroenteritis. Which item is appropriate to offer the client? 1. Soft custard. 2. Orange juice. 3. Clam chowder. 4. Fat-free beef broth. The correct answer is 4. Fat-free beef broth. Rationale: a clear liquid diet consists of foods that are relatively transparent. Soft custard and orange juice would be included in a full liquid diet because they are opaque, not clear. Clam chowder is opaque and also includes pieces of clams, thus eliminating it from a full liquid diet. Question 2. A client with heart disease is instructed regarding a low-fat diet. The nurse determines that the client understands the diet if the client states to avoid which food item? 1. Apples. 2. Cheese. 3. Oranges. 4. Skim milk. The correct answer is 2. Cheese. Rationale: fruits, vegetables, and skim milk contain minimal amounts of fat. Cheese is high in fat. Question 3. The nurse reinforces instructions to a client to increase the amount of riboflavin in the diet. The nurse should tell the client to select which food item that is high in riboflavin. 1. Milk. 2. Tomatoes. 3. Citrus fruits. 4. Green leafy vegetables. The correct answer is 1. Milk. Rationale: food sources of riboflavin include milk, lean meats, fish, and grains. Tomatoes and citrus fruits are high in vitamin C. Green leafy vegetables are high in folic acid. Question 4. A client with a burn injury is transferred to the nursing unit and a regular diet has been prescribed. The nurse encourages the client to eat which dietary items to promote wound healing? 1. Veal, potatoes, gelatin, and orange juice. 2. Chicken breast, broccoli, strawberries, and milk. 3. Peanut butter and jelly sandwich, cantaloupe, and tea. 4. Spaghetti with tomato sauce, garlic bread, and ginger ale. The correct answer is 2. Chicken breast, broccoli, strawberries, and milk. Rationale: protein and vitamin C are necessary for wound healing. Poultry and milk are good sources of protein. Broccoli and strawberries are good sources of vitamin C. Peanut butter is a source of niacin. Gelatin and jelly have no nutrient value. Spaghetti is a complex carbohydrate. Question 5. The nurse has completed diet teaching for a client who has been prescribed a low-sodium diet to treat hypertension. The nurse determines that there is a need for further teaching when the client makes which statement? 1. This diet will help lower my blood pressure. 2. Fresh foods such as fruits and vegetables are high in sodium. 3. This diet is not a replacement for my antihypertensive medications. 4. The reason I need to lower my salt intake is to reduce fluid retention. The correct answer is 2. Fresh foods such as fruits and vegetables are high in sodium. Rationale: a low-sodium diet is used as an adjunct to antihypertensive medications for the treatment of hypertension. Sodium retains fluid, which leads to hypertension secondary to increased fluid volume. Fresh foods such as fruits and vegetables are low in sodium. Question 6. The nurse is assisting with caring for a client who will receive a unit of blood. Just before the infusion, it is most important for the nurse to check which item? 1. Vital signs. 2. Skin color. 3. Oxygen saturation. 4. Latest hematocrit level. The correct answer is 1. Vital signs. Rationale. A change in the vital signs may indicate that a transfusion reaction is occurring. The nurse assesses the client's vital signs before the procedure to obtain a baseline every 15 minutes for the first half hour after beginning the transfusion, and every half hour thereafter. Skin color, oxygen saturation, and most recent hematocrit may be checked, but are not the most important. Question 7. A client who is receiving a blood transfusion rings the call bell for the nurse. When entering the room, the nurse notes that the client is flushed, dyspneic, and complaining of generalized itching. How should the nurse correctly interpret these findings? 1. Bacteremia. 2. Fluid overload. 3. Hypovolemic shock. 4. Transfusion reaction. The correct answer is 4. Transfusion reaction. Rationale. The signs and symptoms exhibited by the client are consistent with a transfusion reaction. With bacteremia, the client would have a fever, which is not part of the clinical picture presented. With fluid overload, the client would have crackles in addition to dyspnea. There is no correlation between the signs mentioned in the question and hypovolemic shock. The signs identified in the question are indicative of an allergic reaction, which is one type of blood transfusion reaction. Question 8. A client who is receiving a blood transfusion has experienced a transfusion reaction. The nurse sends a blood bag that was used for the client to which area? 1. The pharmacy. 2. The laboratory. 3. The blood bank. 4. The nursing cart. The correct answer is 3. The blood bank. Rationale. The nurse prepares to return the blood transfusion bag containing any remaining blood to the blood bank. This allows the blood bank to complete any follow-up testing procedures that are needed after a transfusion reaction has been documented. The remaining options are incorrect. Question 9. The nurse takes a client's temperature before giving a blood transfusion. The temperature is 100 degrees Fahrenheit orally. The nurse reports the finding to the charge nurse and anticipates that which action will take place. 1. The transfusion will begin as prescribed. 2. The blood will be held and the healthcare provider will be notified. 3. The transfusion will begin after the administration of an antihistamine. 4. The transfusion will begin after the administration of 650 milligrams of acetaminophen. The correct answer is 2. The blood will be held and the healthcare provider will be notified. Rationale. If the client has a temperature of 100 degrees Fahrenheit or more, the unit of blood should be held until the healthcare provider is notified and has the opportunity to give further prescriptions. The other options are incorrect actions. Question 10. Which of these clients are most likely to develop fluid overload? Select all that apply. 1. A premature infant. 2. A 101-year-old man. 3. A client on renal dialysis. 4. A client with heart failure. 5. A client with diabetes mellitus. 6. A 29-year-old client with a headache. The correct answers are 1. A premature infant. 2. A 101-year-old man. 3. A client on renal dialysis. And 4. A client with heart failure. Rationale. Clients with cardiac, respiratory, renal, or liver diseases and older and very young clients cannot tolerate an excessive fluid volume. The risk of fluid overload exists with these clients. Question 11. A client has a prescription to receive 1,000 milliliters of 5% dextrose in 0.45% sodium chloride. After gathering the appropriate equipment, the nurse takes which action first before spiking the IV bag with the tubing? 1. Uncaps the distal end of the tubing. 2. Uncaps the spike portion of the tubing. 3. Opens a roller clamp on the IV tubing. 4. Closes a roller clamp on the IV tubing. The correct answer is 4. closes the roller clamp on the IV tubing. Rationale: the nurse should first clamp the tubing to prevent the solution from running freely through the tubing after it is attached to the IV bag. The nurse should next uncap the proximal portion of the tubing and attach it to the IV bag. The IV bag is elevated and the roller clamp is then opened slowly, and the fluid is allowed to flow through the tubing in a controlled fashion to prevent air from remaining in parts of the tubing. Question 12. The nurse is doing a routine assessment of a client's peripheral intravenous site. The nurse notes that the site is cool, pale, and swollen, and that the IV has stopped running. The nurse determines that which has probably occurred: 1. Phlebitis, 2. Infection, 3. Infiltration, 4. Thrombosis. The correct answer is 3. Infiltration. Rationale: an infiltrated IV is one that is dislodged from the vein and is lying in subcutaneous tissue. The pallor, coolness, and swelling are the result of IV fluid being deposited into the subcutaneous tissue. When the pressure in the tissues exceeds the pressure in the tubing, the flow of the IV solution will stop. The other 3 options identify complications that are likely to be accompanied by warmth at the site rather than coolness. Question 13. The nurse is assigned to care for a client with a peripheral intravenous infusion. The nurse is providing hygiene care to the client and should avoid which while changing the client's hospital gown? 1. Using a hospital gown with snaps at the sleeves. 2. Disconnecting the IV tubing from the catheter in the vein. 3. Checking the IV flow rate immediately after changing the hospital gown. 4. Putting the bag and tubing through the sleeve, followed by the client's arm. The correct answer is 2. Disconnecting the IV tubing from the catheter in the vein. Rationale: the tubing should not be removed from the IV catheter. With each break in the system, there is an increased chance of introducing bacteria into the system, which can lead to infection. Using gowns with snaps and inserting the IV bag and tubing through the sleeve of the gown first are appropriate. The flow rate should be checked immediately after changing the hospital gown, because the position of the roller clamp may have been affected during the change. Question 14. The nurse is making a worksheet and listing the tasks that need to be performed for assigned adult clients during the shift. The nurse writes on the plan to check the intravenous of an assigned client who is receiving fluid replacement therapy how frequently? 1. Every hour. 2. Every 3 hours. 3. Every 4 hours. 4. Every 6 hours. The correct answer is 1. Every hour. Rationale: safe nursing practice includes monitoring an IV infusion at least once per hour for an adult client. The remaining options do not provide time frames that are safe or acceptable. Question 15. The nurse is checking the insertion site of a peripheral intravenous catheter. The nurse notes the site to be reddened, warm, painful, and slightly edematous in the area of the vein proximal to the IV catheter. The nurse interprets that this is likely the result of which? 1. Phlebitis of the vein. 2. Infiltration of the IV line. 3. Hypersensitivity to the IV solution. 4. An allergic reaction to the IV catheter material. The correct answer is 1. Phlebitis of the vein. Rationale: phlebitis at an IV site results in discomfort at the site and redness, warmth, and swelling proximal to the IV catheter. The IV catheter should be removed and a new IV line should be inserted at a different site. The remaining options are incorrect. The signs and symptoms in the question are not associated with these conditions. Question 16. The nurse has been instructed to remove an intravenous line. The nurse removes a catheter by withdrawing the catheter while applying pressure to the site with which item? 1. Band-Aid. 2. Alcohol swab. 3. Betadine swab. 4. Sterile 2x2 gauze. The correct answer is 4. Sterile 2x2 gauze. Rationale: a dry, sterile dressing such as sterile 2x2 gauze is used to apply pressure to the site while the catheter is discontinued and removed. This material is absorbent, sterile, and non-irritating to the site. A Band-Aid may be used to cover the site after hemostasis has occurred. An alcohol swab or betadine would irritate the open puncture site and would not stop the blood flow. Question 17. The nurse is preparing an intravenous solution and tubing for a client who requires IV fluids. While preparing to prime the tubing drops and hits the top of the medication cart. The nurse should plan to take which action? 1. Change the IV tubing. 2. Wipe the tubing with betadine. 3. Scrub the tubing with an alcohol swab. 4. Scrub the tubing before attaching it to the IV bag. The correct answer is 1. Change the IV tubing. Rationale: the nurse should change the IV tubing. The tubing has become contaminated, and if used, it could result in a systemic infection in the client. Wiping or scrubbing the tubing is insufficient to prevent systemic infection. Question 18. A client is going to be transfused with a unit of packed red blood cells. The nurse understands that it is necessary to remain with the client for what time period after the transfusion is started? 1. 5 minutes. 2. 15 minutes. 3. 30 minutes. 4. 45 minutes. The correct answer is 2. 15 minutes. Rationale: the nurse must remain with the client for the first 15 minutes of a transfusion, which is the most likely time that a transfusion reaction will occur. This enables the nurse to detect a reaction and intervene quickly. The nurse engages in safe nursing practice by obtaining coverage for the other clients during this time. 5 minutes is too short of a time period, while 30 and 45 minutes are lengthy time periods. Question 19. The nurse is assisting with caring for a client who is receiving a unit of packed red blood cells. The nurse should tell the client that it is most important to report which sign immediately? 1. Sore throat or earache. 2. Chills, itching, or rash. 3. Unusual sleepiness or fatigue. 4. Mild discomfort at the catheter site. The correct answer is 2. Chills, itching, or rash. Rationale: the client is told to report chills, itching, or rash immediately because these could be signs of a possible transfusion reaction. Mild discomfort at the catheter site may be indicative of a problem, or it could result from the size of the IV catheter required to infuse the blood product. Sore throat, earache, sleepiness, and fatigue are unrelated to a transfusion reaction. Question 20. The nurse is assisting with caring for a client who has received a transfusion of platelets. The nurse determines that the client is benefiting most from this therapy if the client exhibits which finding? 1. An increased hematocrit level. 2. An increased hemoglobin level. 3. A decline of the temperature to normal. 4. A decrease in oozing from puncture sites and gums. The correct answer is 4. A decrease in oozing from puncture sites and gums. Rationale: platelets are necessary for proper blood clotting. The client with insufficient platelets may exhibit frank bleeding or the oozing of blood from puncture sites, wound, and mucous membranes. The client's temperature would decline to normal after the infusion of granulocytes if those transfused cells were then instrumental in fighting infection in the body. Increased hemoglobin and hematocrit levels would be seen when the client has received a transfusion of red blood cells. Question 1. The nurse is told that the laboratory result for serum digoxin level is 2.4 nanograms per milliliter. Which action should the nurse take? 1. Withhold the medication. 2. Check the client's last respiratory rate. 3. Record the normal value on the client's flow sheet. 4. Administer the next dose of the medication as scheduled. The correct answer is 1. Withhold the medication. Rationale: the normal therapeutic range for digoxin is 0.5 to 2 nanograms per milliliter. A value of 2.4 nanograms per milliliter exceeds the therapeutic range and could be toxic to the client. The nursing action is to hold further doses of digoxin. Because the value is not normal, option 3 can be eliminated. Administration of the next dose would cause the client to become more toxic. Checking the client's respiratory rate is not applicable at this time. Question 2. A client with atrial fibrillation who is receiving maintenance therapy with warfarin sodium has a prothrombin time of 30 seconds. The nurse anticipates that which will be prescribed. 1. Adding a dose of heparin. 2. Increasing the next dose of warfarin sodium. 3. Withholding the next dose of warfarin sodium. 4. Administering the next dose of warfarin sodium. The correct answer is 3. Withholding the next dose of warfarin sodium. Rationale. The normal PT is 9.6 to 11.8 seconds for the adult male and 9.5 to 11.3 seconds for the adult female. The goal of oral anticoagulation with warfarin sodium therapy is to achieve a PT at 1.5 to 2 times the laboratory control value. A PT of 30 seconds places a client at risk for bleeding, so the nurse should anticipate that the client would not receive further doses at this time. If the level is too high, the antidote vitamin K may be prescribed. The remaining options would make the client even more prone to bleeding. Question 3. A client having pre-admission testing before surgery has blood drawn for the determination of serum electrolyte levels. The nurse determines that which result warrants a call to the healthcare provider by the nurse. 1. Sodium, 148 milliequivalents per liter. 2. Chloride, 101 milliequivalents per liter. 3. Potassium, 3.8 milliequivalents per liter. 4. Bicarbonate, 26 milliequivalents per liter. The correct answer is 1. Sodium, 148 milliequivalents per liter. Rationale. The normal serum electrolyte ranges for adults are as follows. Sodium, 135 to 145 milliequivalents per liter. Potassium, 3.5 to 5.0 milliequivalents per liter. Chloride, 98 to 107 milliequivalents per liter. And bicarbonate venous, 22 to 29 milliequivalents per liter. The only abnormal value identified is the serum sodium level. Question 4. The nurse determines that sodium polystyrene sulfonate has been effective in a client, if which laboratory result is noted. 1. Serum sodium is 148 milliequivalents per liter. 2. Serum glucose is 110 milligrams per deciliter. 3. Serum chloride is 110 milliequivalents per liter. 4. Serum potassium is 4.9 milliequivalents per liter. The correct answer is 4. Serum potassium is 4.9 milliequivalents per liter. Rationale. The normal serum potassium level in the adult is 3.5 to 5.0 milliequivalents per liter. Sodium polystyrene is a medication that is used to treat hyperkalemia. The laboratory values in the remaining options are slightly elevated. In addition, this medication would have no effect on these other electrolytes. Question 5. A client with a history of cardiac disease is scheduled for a dose of furosemide. Which serum potassium level warrants a call to the healthcare provider by the nurse before administering it? 1. 3.2 milliequivalents per liter. 2. 3.8 milliequivalents per liter. 3. For 0.2 milliequivalents per liter. 4. 5.2 milliequivalents per liter. The correct answer is 1. 3.2 milliequivalents per liter. Rationale. The normal adult serum potassium level is 3.5 to 5.0 milliequivalents per liter. A serum potassium level of 3.2 milliequivalents per liter is the only value that falls below the therapeutic range. Administering furosemide to a client with a low potassium level and a cardiac history could precipitate ventricular dysrhythmias in the client. Even though a result of 5.2 milliequivalents per liter is high, administration of the furosemide can only assist with excretion of the excess potassium. Question 6. A client with diabetes mellitus has a blood sample drawn for the determination of a fasting blood glucose level. When reviewing the client's results, the nurse determines that which requires a call to the healthcare provider for intervention. 1. 75 milligrams per deciliter. 2. 92 milligrams per deciliter. 3. 120 milligrams per deciliter. 4. 240 milligrams per deciliter. The correct answer is 4. 240 milligrams per deciliter. Rationale. The normal fasting blood glucose level is 70 to 100 milligrams per deciliter in the adult client without diabetes and 70 to 130 in the client with diabetes. Values above the normal range should be evaluated to determine if further intervention is needed. The most critical value is 240 milligrams per deciliter. Question 7. A client with a history of gastrointestinal bleeding has a platelet count of 300,000. Which action by the nurse is most appropriate after this report? 1. Report the abnormally low count. 2. Report the abnormally high count. 3. Place the client on bleeding precautions. 4. Place the normal report in the client's medical record. The correct answer is 4. Place the normal report in the client's medical record. Rationale. A normal platelet count ranges from 150,000 to 400,000. The nurse should place the report that contains the normal laboratory value into the client's medical record. The remaining options are incorrect and unnecessary. Question 8. The nurse is reviewing the serum magnesium results for a group of clients. Which results warrant a call to the healthcare provider by the nurse? Select all that apply. 1. 1.2 milligrams per deciliter. 2. 2.0 milligrams per deciliter. 3. 2.6 milligrams per deciliter. 4. 3.0 milligrams per deciliter. 5. 4.2 milligrams per deciliter. The correct answers are 1. 1.2 milligrams per deciliter, for 3.0 milligrams per deciliter, and 5. For 0.2 milligrams per deciliter. Rationale. The normal magnesium level in an adult client is 1.6 to 2.6 milligrams per deciliter. Magnesium levels that are below or above the normal range should be reported to the healthcare provider. Question 9. A client has a history of mild renal insufficiency. Which serum creatinine level should the nurse determine is consistent with this problem? 1. 0.6 milligrams per deciliter. 2. 1.1 milligrams per deciliter. 3. 1.9 milligrams per deciliter. 4. 3.5 milligrams per deciliter. The correct answer is 3. 1.9 milligrams per deciliter. Rationale. The normal serum creatinine level is 0.6 to 1.3 milligrams per deciliter. The client with mild renal insufficiency would have a slightly elevated level, which would be the value of 1.9 milligrams per deciliter. Creatinine levels of 3.5 milligrams per deciliter may be associated with acute kidney injury or chronic kidney disease. Question 10. A client with a seizure disorder is taking phenytoin. A sample for a serum phenytoin level is drawn, and the nurse determines that the next dose of the medication may be administered if which laboratory result is noted? 1. 17 micrograms per milliliter. 2. 21 micrograms per milliliter. 3. 24 micrograms per milliliter. 4. 27 micrograms per milliliter. The correct answer is 1. 17 micrograms per milliliter. Rationale. The therapeutic range for serum phenytoin level is 10 to 20 micrograms per milliliter, so the next dose of phenytoin should be given if the level is 17 micrograms per milliliter. If the level is too high, such as in the remaining options, the client could experience phenytoin toxicity. Question 11. A client with hepatic cirrhosis has been consuming a diet with optimal amounts of protein. The nurse determines that the client's consumption of dietary protein has been most effective if the total protein level is which value? 1. 0.4 grams per deciliter. 2. 3.7 grams per deciliter. 3. 5.4 grams per deciliter. 4. 6.8 grams per deciliter. The correct answer is 4. 6.8 grams per deciliter. Rationale. The normal range for protein level in the adult client is 6 to 8 grams per deciliter, which makes the value of 6.8 grams per deciliter the correct choice. The remaining options are all low levels and do not indicate that the diet has been most effective. Question 12. A client was diagnosed with acute pancreatitis 10 days ago. The nurse interprets that the episode of acute pancreatitis is fully resolved if the serum lipase level drops to which value? 1. 135 units per liter. 2. 175 units per liter. 3. 200 units per liter. 4. 250 units per liter. The correct answer is 1. 135 units per liter. Rationale. The normal serum lipase level is 10 to 140 units per liter. The client who is recovering from acute pancreatitis usually has elevated lipase levels for approximately 10 days after the onset of symptoms. This makes lipase a valuable test for monitoring the client's pancreatic function. The serum lipase level of 135 units per liter indicates resolution of the acute pancreatitis because it is a normal value. The remaining options identify elevated lipase levels. Question 13. A client arrives in the emergency department complaining of chest pain that began 4 hours ago. A troponin T blood specimen is obtained, and the results indicate a level of 0.6 nanograms per milliliter. How should the nurse correctly interpret these results? 1. It is a normal level. 2. It is a low value that may be indicative of gastritis. 3. The level is indicative of a myocardial infarction. 4. The level indicates the presence of possible angina. The correct answer is 3. The level is indicative of a myocardial infarction. Rationale. Troponins are regulatory proteins that are found in striated muscle. The troponins function together in the contractile apparatus for striated muscle in the skeletal muscle and the myocardium. Increased amount of troponins are released into the bloodstream when an infarction causes damage to the myocardium. A troponin T level greater than 0.1 to 0.2 nanograms per milliliter is consistent with a myocardial infarction. A normal troponin I level is less than 0.6 nanograms per milliliter, whereas a level greater than 1.5 nanograms per milliliter is consistent with a myocardial infarction. A troponin T level of 0.6 is not normal, so that option can be eliminated. Troponin T does not test for gastritis or angina, so those options can also be eliminated. Question 14. A client has a hemoglobin level of 10.8 grams per deciliter. The nurse interprets that this result is most likely the result of which factor in the client's history? 1. Heart failure. 2. Dehydration. 3. Iron deficiency anemia. 4. Chronic obstructive pulmonary disease. The correct answer is 3. Iron deficiency anemia. Rationale. The normal hemoglobin level for an adult female client is 12 to 15 grams per deciliter and 14 to 16.5 for a male client. A low hemoglobin level usually indicates anemia. Iron deficiency anemia can result in lower hemoglobin levels. Heart failure and COPD may increase the hemoglobin level as a result of the body's need for more oxygen carrying capacity. Dehydration may increase the hemoglobin level by hemoconcentration. Question 15. The nurse determines that an adult male client admitted with dehydration and a hematocrit level of 56% has received adequate fluid volume replacement, if which repeat hematocrit level is noted. 1. 48%. 2. 54%. 3. 60%. 4. 64%. The correct answer is 1. 48%. Rationale. The normal hematocrit level for an adult male is 42% to 52%. Thus, 48% is the only correct choice. The client who is dehydrated has an elevated level as a result of hemoconcentration. The client's level may be expected to drift back down to within the normal range after the fluid volume has been adequately restored. The remaining options are too high and indicate fluid replacement is still indicated. Question 16. A client is having problems with blood clotting. Which food item should the nurse encourage the client to eat? 1. Legumes. 2. Citrus fruits. 3. Vegetable oils. 4. Green leafy vegetables. The correct answer is 4. Green leafy vegetables. Rationale. Green leafy vegetables are high in vitamin K, which acts as a catalyst for facilitating blood clotting factors. Legumes are high in folic acid and thiamine. Citrus fruits are high in vitamin C, which helps with wound healing. Vegetable oil is high in vitamin E, which acts as an antioxidant. Question 17. When reinforcing instructions to a client with acute diverticulitis, which should the nurse include? 1. Avoid whole grain products. 2. Limit fluids to 1,000 milliliters daily. 3. Increase intake of seeds and nuts. 4. Increase intake of raw fruits and vegetables. The correct answer is 1. Avoid whole grain products. Rationale. Diet therapy for acute diverticulitis involves allowing the bowel to rest by avoiding high-fiber foods, such as whole grain products and raw fruits and vegetables. Fluids are encouraged rather than restricted. Seeds and nuts are to be avoided so that they do not become trapped in the diverticula and cause irritation. In non-acute stages, a high-fiber diet may be prescribed. Question 18. A client is a lacto-vegetarian. Which food item should the nurse remove from the tray? 1. Eggs. 2. Milk. 3. Cheese. 4. Broccoli. The correct answer is 1. Eggs. Rationale. Eggs are not consumed by lacto-vegetarians. Other dairy and plant products are eaten by lacto-vegetarians. Question 19. A low-sodium diet has been prescribed for a client with hypertension. Which food selected from the menu by the client indicates an understanding of this diet? 1. Baked turkey. 2. Tomato soup. 3. Boiled shrimp. 4. Chicken gumbo. The correct answer is 1. Baked turkey. Rationale. Regular soup contains 900 milligrams of sodium. Fresh shellfish contains 50 milligrams of sodium. Poultry contains 25 milligrams of sodium. Question 20. The nurse is providing dietary instructions to a client with gout. The nurse should tell the client to avoid which food item? 1. Scallops. 2. Chocolate. 3. Cornbread. 4. Macaroni products. The correct answer is 1. Scallops. Rationale. Scallops should be omitted from the diet of a client who has gout because of the high purine content. The food items identified in the remaining options have negligible purine content and may be consumed by the client with gout. Question 1. The nurse is reading the healthcare provider's progress notes in the client's record and sees that the HCP has documented insensible fluid loss of approximately 800 milliliters daily. Which client is at risk for this loss? 1. Client with a draining wound. 2. Client with a urinary catheter. 3. Client with a fast respiratory rate. 4. Client with a nasogastric tube to low suction. The correct answer is 3. Client with a fast respiratory rate. Rationale. Sensible losses are those that the person is aware of, such as those that occur through wound drainage, GI tract losses, and urination. Insensible losses may occur without the person's awareness. Insensible losses occur daily through the skin and the lungs. Question 2. The nurse is reviewing the health records of assigned clients. The nurse should plan care knowing that which client is at the least likely risk for the development of third spacing. 1. The client with sepsis. 2. The client with cirrhosis. 3. The client with kidney failure. 4. The client with diabetes mellitus. The correct answer is 4. The client with diabetes mellitus. Rationale. Fluid that shifts into the interstitial spaces and remains there is referred to as third space fluid. Common sites for third spacing include the abdomen, pleural cavity, peritoneal cavity, and pericardial sac. Third space fluid is physiologically useless because it does not circulate to provide nutrients for the cells. Risk factors include liver or kidney disease, major trauma, burns, sepsis, wound healing, major surgery, malignancy, malabsorption syndrome, malnutrition, alcoholism, and older age. Question 3. The nurse is reviewing the health records of assigned clients. The nurse should plan care knowing that which client is at risk for fluid volume deficit. 1. The client with cirrhosis. 2. The client with a colostomy. 3. The client with heart failure. 4. The client with decreased kidney function. The correct answer is 2. The client with colostomy. Rationale. Causes of fluid volume deficit include vomiting, diarrhea, conditions that cause increased respirations or increased urinary output, insufficient intravenous fluid replacement, draining fistulas, ileostomy, and colostomy. A client with cirrhosis, heart failure, or decreased kidney function is at risk for fluid volume excess. Question 4. The nurse is caring for a client who has been taking diuretics on a long-term basis. Which findings should the nurse expect to note as a result of this long-term use? 1. Gurgling respirations. 2. Increased blood pressure. 3. Decreased hematocrit level. 4. Increased specific gravity of the urine. The correct answer is 4. Increased specific gravity of the urine. Rationale. Clients taking diuretics on a long-term basis are at risk for fluid volume deficit. Findings of fluid volume deficit include increased respirations and heart rate, decreased central venous pressure, weight loss, poor skin turgor, dry mucous membranes, decreased urine volume, increased specific gravity of the urine, dark-colored and odorous urine, an increased hematocrit level, and an altered level of consciousness. Gurgling respirations, increased blood pressure, and decreased hematocrit as a result of hemodilution are seen in a client with fluid volume excess. Question 5. The nurse reviews electrolyte values and notes a sodium level of 130 milliequivalents per liter. The nurse expects that the sodium level would be noted in a client with which condition? 1. The client with watery diarrhea. 2. The client with diabetes insipidus. 3. The client with an inadequate daily water intake. 4. The client with the syndrome of inappropriate secretion of antidiuretic hormone. The correct answer is 4. The client with a syndrome of inappropriate secretion of antidiuretic hormone. Rationale. Hyponatremia is a serum sodium level less than 135 milliequivalents per liter. Hyponatremia can occur secondary to SIADH. The client with an inadequate daily water intake, watery diarrhea, or diabetes insipidus is at risk for hypernatremia. Question 6. The nurse is caring for a client with leukemia and notes that the client has poor skin turgor and flat neck and hand veins. The nurse suspects hyponatremia. Which additional signs/symptoms should the nurse expect to note in this client if hyponatremia is present? 1. Intense thirst. 2. Slow bounding pulse. 3. Dry mucous membranes. 4. Postural blood pressure changes. The correct answer is 4. Postural blood pressure changes. Rationale. Postural blood pressure changes occur in the client with hyponatremia. Intense thirst and dry mucous membranes are seen in clients with hypernatremia. A slow, bounding pulse is not indicative of hyponatremia. In a client with hyponatremia, a rapid, thready pulse is noted. Question 7. The nurse is caring for a client with a diagnosis of hyperparathyroidism. Laboratory studies are performed, and the serum calcium level is 12.0 milligrams per deciliter. Based on this laboratory value, the nurse should take which action? 1. Document the value in the client's record. 2. Inform the charge nurse of the laboratory value. 3. Place the laboratory result form in the client's record. 4. Reassure the client that the laboratory result is normal. The correct answer is 2. Inform the charge nurse of the laboratory value. Rationale. The normal serum calcium level ranges from 8.6 to 10.0 milligrams per deciliter. The client is experiencing hypercalcemia, and the nurse will inform the charge nurse of the laboratory value. Because the client is experiencing hypercalcemia, the remaining options are incorrect actions. Question 8. The nurse is caring for a client with a suspected diagnosis of hypercalcemia. Which sign/symptom is an indication of this electrolyte imbalance? 1. Twitching. 2. Positive Trousseau sign. 3. Hyperactive bowel sounds. 4. Generalized muscle weakness. The correct answer is 4. Generalized muscle weakness. Rationale: generalized muscle weakness is seen in clients with hypercalcemia. Twitching, positive Trousseau sign, and hyperactive bowel sounds are signs of hypocalcemia. Question 9. The nurse is instructing a client on how to decrease the intake of calcium in the diet. The nurse should tell the client that which food item is least likely to contain calcium. 1. Milk. 2. Butter. 3. Spinach. 4. Collard greens. The correct answer is 2. Butter. Rationale: butter comes from milk fat and does not contain significant amount of calcium. Milk, spinach, and collard greens are calcium-containing foods and should be avoided by the client on a calcium-restricted diet. Question 10. The nurse is caring for a client with hyperparathyroidism and notes that the client's serum calcium level is 13 milligrams per deciliter. Which prescribed medication should the nurse prepare to assist in administering to the client? 1. Calcium chloride. 2. Calcium gluconate. 3. Calcitonin. 4. Large doses of vitamin D. The correct answer is 3. Calcitonin. Rationale: the normal serum calcium level is 8.6 to 10.0 milligrams per deciliter. This client is experiencing hypercalcemia. Calcium gluconate and calcium chloride are medications used for the treatment of tetany, which occurs as a result of acute hypocalcemia. In hypercalcemia, large doses of vitamin D need to be avoided. Calcitonin, a thyroid hormone, decreases the plasma calcium level by inhibiting bone resorption and lowering the serum calcium concentration. Question 11. A client has the following laboratory values: a pH of 7.55, an HCO3 level of 22, and a PCO2 of 30. Which action should the nurse take? 1. Perform Allen's test. 2. Prepare the client for dialysis. 3. Administer insulin as prescribed. 4. Encourage the client to slow down breathing. The correct answer is 4. Encourage the client to slow down breathing. Rationale: the client is in respiratory alkalosis based on the laboratory results of a high pH and a low PCO2 level. Interventions for respiratory alkalosis are the voluntary holding of breath or slowed breathing and the rebreathing of exhaled CO2 by methods, such as using a paper bag or a rebreathing mask as prescribed. Performing Allen's test would be incorrect because the blood specimen has already been drawn and the laboratory results have been completed. Dialysis and insulin administration are interventions for metabolic acidosis. Question 12. The nurse is told that the blood gas results indicate a pH of 7.50 and a PCO2 of 32 milligrams per deciliter. The nurse determines that these results are indicative of which acid-base disturbance? 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The correct answer is 4. Respiratory alkalosis. Rationale: the normal pH is 7.35 to 7.45. In a respiratory condition, an opposite relationship will be seen between the pH and the PCO2, as is seen in the correct option. In an alkalotic condition, the pH is increased. In an acidotic condition, the pH is decreased so both metabolic acidosis and respiratory acidosis can be eliminated. Metabolic alkalosis can also be eliminated because both pH and HCO3 are increased above normal values in this condition. Question 13. A client is scheduled for blood to be drawn from the radial artery for an arterial blood gas determination. The nurse assists with performing Allen's test before drawing the blood to determine the adequacy of which? 1. Ulnar circulation. 2. Carotid circulation. 3. Femoral circulation. 4. Brachial circulation. The correct answer is 1. Ulnar circulation. Rationale: before performing a radial puncture to obtain an arterial specimen for ABGs, Allen's test should be performed to determine adequate ulnar circulation. Failure to assess collateral circulation could result in severe ischemic injury to the hand if damage to the radial artery occurs with arterial puncture. The remaining options are not associated with this test. Question 14. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client closely for which acid-base disorder that is most likely to occur in this situation. 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The correct answer is 2. Metabolic alkalosis. Rationale: the loss of gastric fluid via nasogastric suction or vomiting causes a metabolic condition. This also results in an alkalotic condition due to the loss of hydrochloric acid through gastrointestinal fluid losses. Also, the options denoting a respiratory problem, respiratory acidosis and respiratory alkalosis, can be easily eliminated. Question 15. The nurse is caring for a client with severe diarrhea. The nurse monitors the client closely, understanding that this client is at risk for developing which acid-base disorder? 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The correct answer is 1. Metabolic acidosis. Rationale: intestinal secretions high in bicarbonate may be lost through enteric drainage tubes, an ileostomy, or diarrhea. The decreased bicarbonate level creates the actual base deficit of metabolic acidosis. The remaining options are unlikely to occur in a client with severe diarrhea. Question 16. The nurse is caring for a client with diabetic ketoacidosis and observes that the client is experiencing abnormally deep, regular, rapid respirations. How should the nurse correctly document this observation in the medical record? 1. Apnea observed. 2. Brady noted. 3. Shane-Stokes demonstrated. 4. Kussmaul's respirations observed. The correct answer is 4. Kussmaul's respirations observed. Rationale: abnormally deep, regular, and rapid respirations observed in the client with diabetic ketoacidosis are documented as Kussmaul's respirations. In apnea, respirations cease for several seconds. In Brady, respirations are regular but abnormally slow. Shane-Stokes respirations gradually become more shallow and are followed by periods of apnea, with repetition of the pattern. Question 17. The nurse is caring for a client with diagnosis of chronic obstructive pulmonary disease, COPD. The nurse should monitor the client for which acid-base imbalance? 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The correct answer is 3. Respiratory acidosis. Rationale: respiratory acidosis most often occurs as a result of primary defects in the function of the lungs or changes in normal respiratory patterns from secondary problems. Chronic respiratory acidosis is most commonly caused by COPD. Acute respiratory acidosis also occurs in clients with COPD when superimposed respiratory infection or concurrent respiratory disease increases the work of breathing. The remaining options are not likely to occur unless other conditions complicate the COPD. Question 18. When caring for the following group of clients, who does the nurse determine is at risk for development of metabolic alkalosis? Select all that apply. 1. Client with emphysema. 2. Client who is hyperventilating. 3. Client with chronic kidney disease. 4. Client who has been vomiting for 2 days. 5. Client receiving furosemide Lasix 40 milligrams daily. 6. Client admitted with acetylsalicylic acid, aspirin, overdose. The correct answers are for client who has been vomiting for 2 days and 5. Client receiving furosemide Lasix 40 milligrams daily. Rationale: metabolic alkalosis is caused by any condition that creates the acid-base imbalance through either an increase in bases or a deficit of acids, such as a client who has been vomiting for 2 days and the client receiving furosemide daily. Recall that clients with emphysema and hyperventilation are at risk for a respiratory acid-base disturbance. Chronic kidney disease and aspirin overdose will result in metabolic acidosis. Question 19. The nurse is caring for a client with respiratory insufficiency. The arterial blood gas results indicate a pH of 7.50 and a PCO2 of 30, and the nurse is told that the client is experiencing respiratory alkalosis. Which additional laboratory value should the nurse expect to note? 1. A sodium level of 145 milliequivalents per liter. 2. A potassium level of 3.2 milliequivalents per liter. 3. A magnesium level of 2.4 milligrams per deciliter. 4. A phosphorus level of 4.0 milligrams per deciliter. The correct answer is 2. A potassium level of 3.2 milliequivalents per liter. Rationale. Signs/symptoms of respiratory alkalosis include tachypnea, mental status changes, dizziness, pallor around the mouth, spasms of the muscles of the hands, and hypokalemia. The remaining options identify normal laboratory results. Question 20. The charge nurse reviews the results of the arterial blood gases with the staff nurse and tells the nurse that the client is experiencing respiratory acidosis. The staff nurse should expect to note, which on the laboratory result report: 1. pH 7.50, PCO2 52. 2. pH 7.35, PCO2 40. 3. pH 7.25, PCO2 50. 4. pH 7.50, PCO2 30. The correct answer is 3. pH 7.25, PCO2 50. Rationale. The normal pH is 7.35 to 7.45, and the normal PCO2 value is 35 to 45. In respiratory acidosis, the pH is down and the PCO2 is up. Therefore, the option with the pH of 7.25 and the PCO2 of 50 is the only option that reflects an acidotic condition. Options with an elevated pH indicate an alkalotic condition. Option 2 identifies normal values for pH and PCO2. Question 1. The nurse is preparing to assist a client of Orthodox Jewish faith with eating lunch. A kosher meal is delivered to the client. Which nursing action is appropriate when assisting the client with the meal? 1. Unwrapping the eating utensils for client. 2. Replacing the plastic utensils with metal utensils. 3. Carefully transferring the food from paper plates to glass plates. 4. Allowing the client to unwrap the utensils and prepare his own meal for eating. The correct answer is 4. Allowing the client to unwrap the utensils and prepare his own meal for eating. Rationale. Kosher meals arrive on paper plates and with plastic utensils sealed. Healthcare providers should not unwrap the utensils or transfer the food to another serving dish. Although the nurse may want to be helpful by assisting the client with the meal, the only appropriate option for this client is option 4. Question 2. The client asks the nurse about various herbal therapies available for the treatment of insomnia. The nurse should encourage the client to discuss the use of which product with the healthcare provider. 1. Garlic. 2. Valerian. 3. Lavender. 4. Glucosamine. The correct answer is 2. Valerian. Rationale. Valerian has been used to treat insomnia, hyperactivity, and stress. It has also been used to treat nervous disorders, such as anxiety and restlessness. Garlic is used as an antioxidant and to lower cholesterol levels. Lavender is used as an antiseptic and fragrance for a mild sedative effect. Glucosamine is an amino acid that assists with the synthesis of cartilage. Question 3, which is a recommended guideline for safe computerized charting. 1. Passwords to the computer system should only be changed if lost. 2. Computer terminals may be left unattended during client care activities. 3. Accidental deletions from a computerized file need to be reported to the nursing manager or supervisor. 4. Copies of printouts from computerized files should be kept on a clipboard at the nurse's station for other nurses to access. The correct answer is 3. Accidental deletions from the computerized file need to be reported to the nursing manager or supervisor. Rationale. After any inadvertent deletions of permanent computerized records, the nurse should type an explanation into computer file with the date, time, and his or her initials. The nurse should also contact the nursing manager or supervisor with a written explanation of the situation. Options 1, 2, and 4 represent unsafe charting actions. Only option 3 follows the guidelines for safe computer charting. Question 4. The nurse enters a client's room and finds a client sitting on the floor. The nurse checks the client thoroughly and then assists the client back into bed. The nurse completes an incident report, and the nursing supervisor and healthcare provider are notified of the incident. Which is the next nursing action regarding the incident? 1. Place the incident report in the client's chart. 2. Make a copy of the incident report for the HCP. 3. Document a complete entry in the client's record concerning the incident. 4. Document in the client's record that an incident report has been completed. The correct answer is 3. Document a complete entry in the client's record concerning the incident. Rationale. The incident report is confidential and privileged information, and it should not be copied, placed in the chart, or have any reference made to it in the client's record. The incident report is not a substitute for a complete entry in the client's record concerning the incident. Question 5. An unconscious client, bleeding profusely, is brought to the emergency department after a serious accident. Surgery is required immediately to save the client's life. With regard to informed consent for the surgical procedure, which is the best action? 1. Call the nursing supervisor to initiate a court order for the surgical procedure. 2. Try calling the client's spouse to obtain telephone consent before the surgical procedure. 3. Ask the friend who accompanied the client to the emergency department to sign the consent form. 4. Transport the client to the operating department immediately, as required by the healthcare provider, without obtaining an informed consent. The correct answer is 4. Transport the client to the operating department immediately, as required by the healthcare provider, without obtaining an informed consent. Rationale. Generally, there are only 2 instances in which the informed consent of an adult client is not needed. One instance is when an emergency is present and delaying treatment for the purpose of obtaining informed consent will result in injury or death to the client. The second instance is when the client waives a right to give informed consent. Question 6. The nurse enters a client's room and notes that the client's lawyer is present and that the client is preparing a living will. The living will requires that the client's signature be witnessed, and the client asks the nurse to witness the signature, which is the appropriate nursing action. 1. Decline to sign the will. 2. Sign the will as a witness to the signature only. 3. Call the hospital lawyer before signing the will. 4. Sign the will, clearly identifying credentials and employment agency. The correct answer is 1. Decline to sign the will. Rationale. Living wills are required to be in writing and signed by the client. The client's signature either must be witnessed by specified individuals or notarized. Many states prohibit any employee from being a witness, including the nurse and facility in which the client is receiving care. Question 7. A nurse lawyer provides an education session to the nursing staff regarding client rights. The nurse asks the lawyer to describe an example that may relate to invasion of client privacy. Which nursing action indicates a violation of client privacy? 1. Threatening to place a client in restraints. 2. Performing a surgical procedure without consent. 3. Taking photographs of the client without consent. 4. Telling the client that he or she cannot leave the hospital. The correct answer is 3. Taking photographs of the client without consent. Rationale. Invasion of privacy takes place when an individual's private affairs are intruded on unreasonably. Threatening to place a client in restraints constitutes assault. Performing a surgical procedure without consent is an example of battery. Not allowing a client to leave the hospital constitutes false imprisonment. Question 8. The nurse is recording a nursing hands-off end of shift report for a client. Which information needs to be included? 1. As needed medications given that shift. 2. Normal vital signs that have been normal since admission. 3. All of the tests and treatments the client has had since admission. 4. Total number of scheduled medications that the client received on that shift. The correct answer 1. As needed medications given that shift. Rationale. The nursing hands-off report needs to be an efficient and accurate account of the client's condition during the last shift. It needs to include pertinent information about the client, such as tests and treatments, as needed medications given or therapies performed during the past 24 hours, including the client's response to them, changes in the client's condition, scheduled tests and treatments, current problems, and any other special concerns. It is not necessary to include the total number of medications given or a list of all the tests and treatments that the client has had since admission. Only significant vital signs need to be included. Question 9. The nurse is planning the client assignments for the day. Which is the most appropriate assignment for the unlicensed assistive personnel? 1. A client who requires irrigation. 2. A client who requires frequent ambulation. 3. A client who is receiving continuous tube feedings. 4. A client who requires frequent vital signs after a cardiac catheterization. The correct answer is 2. A client who requires frequent ambulation. Rationale. The nurse must determine the most appropriate assignment on the basis of the skills of the staff member and the needs of the client. In this case, the most appropriate assignment for the UAP would be to care for the client who requires frequent ambulation. The UAP is skilled in this task. The client who had a cardiac catheterization will require specific monitoring in addition to that of the vital signs. Wound irrigations and tube feedings are not performed by unlicensed personnel. Question 10. The nurse employed in a long-term care facility is planning the client assignments for the shift. Which client should the nurse assign to the unlicensed assistive personnel? 1. A client who requires a 24-hour urine collection. 2. A client who requires twice daily dressing changes. 3. A client who is on a bowel management program and requires rectal suppositories and a daily enema. 4. A client with diabetes mellitus who requires daily insulin and the reinforcement of dietary measures. The correct answer is 1. A client who requires a 24-hour urine collection. Rationale. The nurse must determine the most appropriate assignment on the basis of the skills of the staff member and the needs of the client. The assignment of tasks needs to be implemented on the basis of the job description of the individual's level of clinical competence and state law. Options 2, 3, and 4 involve care that requires the skill of a licensed nurse. A UAP is not licensed. Question 11. The nurse is assigned to care for 4 clients. When planning client rounds, which client should the nurse check first? 1. A client on a ventilator. 2. A client in skeletal traction. 3. A postoperative client preparing for discharge. 4. A client admitted on the previous shift who has a diagnosis of gastroenteritis. The correct answer is 1. A client on a ventilator. Rationale. The airway is always a priority, and the nurse first checks the client on a ventilator. The clients described in options 2, 3, and 4 have needs that will be identified as intermediate priorities. Question 12. The nurse employed in an emergency department is assigned to assist with the triage of clients arriving to the emergency department. The nurse should assign priority to which client? 1. A client complaining of muscle aches, a headache, and malaise. 2. A client who twisted her ankle when she fell while inline skating. 3. A client with a minor laceration on the index finger sustained while cutting an eggplant. 4. A client with chest pain who states that he just ate pizza that was made with a very spicy sauce. The correct answer is 4. A client with chest pain who states that he just ate pizza that was made with a very spicy sauce. Rationale. In an emergency department, triage involves classifying clients according to their need for care, and it includes establishing priorities of care, the type of illness, the severity of the problem, and the resources available govern the process. Clients with trauma, chest pain, severe respiratory distress, cardiac arrest, limb amputation, or acute neurological deficits, and those who sustain a chemical splash to the eyes are classified as emergent, and these clients are the number 1 priority. Clients with conditions such as simple fractures, asthma without respiratory distress, fever, hypertension, abdominal pain, or renal stones have urgent needs, and these clients are classified as the number 2 priority. Clients with conditions such as minor lacerations, sprains, or cold symptoms are classified as non-urgent, and they are the number 3 priority. Question 13. The nurse is educating a new nurse about mass casualty events, disasters. Which statement by the new nurse indicates a need for further teaching? Select all that apply. 1. An event is termed a mass casualty when it overwhelms local medical capabilities. 2. Mass casualty events do not require an increase in the number of staff that are needed. 3. A mass casualty event occurs only within the health care facility and could endanger staff. 4. A mass casualty event occurs if a fight between visitors occurs in the emergency department. 5. Mass casualty events may require the collaboration of many local agencies to handle the situation. The correct answers are 2. Mass casualty events do not require an increase in the number of staff that are needed. 3. A mass casualty event occurs only within the health care facility and could endanger staff. 4. A mass casualty event occurs if a fight between visitors occurs in the emergency department. Rationale: mass casualty events, also known as disasters, overwhelm local medical capabilities and may require the collaboration of multiple agencies and healthcare facilities to handle the crises. This type of event can occur in the healthcare facility or outside of it. Fights in the emergency department are not termed mass casualty events, but are agency security and local enforcement issues. Mass casualty events almost always require an increase in staffing to ensure safe patient care. Question 14. A client experiences a cardiac arrest. The nurse leader quickly responds to the emergency and assigns clearly defined tasks to the work group. In this situation, the nurse is implementing which leadership style? 1. Autocratic. 2. Situational. 3. Democratic. 4. Laissez-faire. The correct answer is 1. Autocratic. Rationale: autocratic leadership is an approach in which the leader retains all authority and is primarily concerned with task accomplishment. It is an effective leadership style to implement in an emergency or crisis situation. The leader assigns clearly defined tasks and establishes one-way communication with the work group, and he or she makes all decisions independently. Situational leadership is a comprehensive approach that incorporates the leader's style, the maturity of the work group, and the situation at hand. Democratic leadership is a people-centered approach that is primarily concerned with human relations and teamwork. This leadership style facilitates goal accomplishment and contributes to the growth and development of the staff. Laissez-faire leadership is a permissive style in which the leader gives up control and delegates all decision-making to the work group. Question 15. The nurse has delegated several nursing tasks to staff members. Which is the nurse's primary responsibility after the delegation of the tasks? 1. Document that the task was completed. 2. Assign the tasks that were not completed to the next nursing shift. 3. Allow each staff member to make judgments when performing the tasks. 4. Perform follow-up with each staff member regarding the performance and outcome of the task. The correct answer is 4. Perform follow-up with each staff member regarding performance and outcome of the task. Rationale: the ultimate responsibility for a task lies with the person who delegated it. Therefore, it is the nurse's primary responsibility to follow up with each staff member regarding the performance of the task and the outcomes related to implementing the task. Not all staff members have the education, knowledge, and ability to make judgments about tasks being performed. The nurse documents that the task has been completed, but this would not be done until follow-up was implemented and outcomes were identified. It is not appropriate to assign the tasks that were not completed to the next nursing shift. Question 16. The nurse is assigned to care for 4 clients. When planning client rounds, which client should the nurse collect data from first? 1. A client scheduled for a chest x-ray. 2. A client requiring daily dressing changes. 3. A postoperative client preparing for discharge. 4. A client receiving oxygen who is having difficulty breathing. The correct answer is 4. A client receiving oxygen who is having difficulty breathing. Rationale: the airway is always a priority, and the nurse would attend a client who has been experiencing an airway problem first. Question 17. The nurse who is caring for a client with kidney failure notes that the client is dyspneic and crackles are heard on auscultation of the lungs. Which additional signs/symptoms should the nurse expect to note in this client? 1. Rapid weight loss. 2. Flat hand and neck veins. 3. A weak and thready pulse. 4. An increase in blood pressure. The correct answer is 4. An increase in blood pressure. Rationale: impaired cardiac or kidney function can result in fluid volume excess. Findings associated with fluid volume excess include cough, dyspnea, crackles, tachypnea, tachycardia, an elevated blood pressure, a bounding pulse, an elevated central venous pressure, weight gain, edema, neck and hand vein distension, an altered level of consciousness, and a decreased hematocrit level. Question 18. The nurse is reviewing the health records of assigned clients. The nurse should plan care knowing that which client is at risk for a potassium deficit. 1. The client with Addison's disease. 2. The client with metabolic acidosis. 3. The client with intestinal obstruction. 4. The client receiving nasogastric suction. The correct answer is 4. The client receiving nasogastric suction. Rationale: potassium-rich gastrointestinal fluids are lost through GI suction, which places a client at risk for hypokalemia. The client with intestinal obstruction, Addison's disease, and metabolic acidosis is at risk for hyperkalemia. Question 19. The nurse reviews a client's electrolyte results and notes a potassium level of 5.5 milliequivalent per liter. The nurse understands that a potassium value at this level should be noted with which condition? 1. Diarrhea. 2. Traumatic burn. 3. Cushing syndrome. 4. Overuse of laxatives. The correct answer is 2. Traumatic burn. Rationale: a serum potassium level that exceeds 5.0 milliequivalent per liter is indicative of hyperkalemia. Clients who experience the cellular shifting of potassium, as in the early stages of massive cell destruction, are at risk for hyperkalemia. The client with Cushing syndrome or diarrhea and the client who has been overusing laxatives are at risk for hypokalemia. Question 20. The nurse reviews a client's electrolyte results and notes that the potassium level is 5.4 milliequivalent per liter. Which should the nurse observe for on the cardiac monitor as a result of this laboratory value? 1. ST elevation. 2. Peak P waves. 3. Prominent U waves. 4. Narrow peak T waves. The correct answer is 4. Narrow peak T waves. Rationale: a serum potassium level of 5.4 milliequivalent per liter is indicative of hyperkalemia. Cardiac changes include a wide, flat P wave, a prolonged PR interval, a widened QRS complex, and narrow peak T waves.
You can check out my nursing exam reviews. Links are in the description. I'll see you guys in the next video. Thanks for watching.